So good morning, everyone, and welcome to the third Innovation Forum organized by IT Food. My name is Afrodita Bilioni, and I will be your host today. First of all, we would like to thank you on behalf of EIT Food for joining us for a series of very interesting sessions during the day today and tomorrow. In order to explain to you how to use the different interaction tools within the platform, we've prepared a quick video, which will be projected right now.
Bienvenidos al tercer Innovation Forum organizado por EIT Food. A continuación, les vamos a explicar las principales funcionalidades de la plataforma para que participen en el evento de forma activa y se sientan parte importante del mismo. En primer lugar, les agradeceríamos que especificaran su nombre y empresa, institución o sociedad científica a la que pertenecen para que tanto los organizadores como el resto de participantes puedan identificarles de forma fácil en el caso de que quieran intervenir en algún momento del evento. Para hacer el cambio, pueden pinchar en los 3 puntos que están situados en la parte superior de la pantalla y les aparecerá la opción de renombrar. Comentarles que hemos silenciado los micrófonos para un óptimo desarrollo de la jornada. Sin embargo, es muy importante para nosotros su interacción, por lo que les agradecemos que hagan uso de las diferentes herramientas de la plataforma para trasladarnos su opinión, comentarios o preguntas. Para ello, en la barra de herramientas situada en la parte inferior, contamos con un apartado de chat donde podrán enviarnos sus preguntas para que los moderadores las trasladen a los expertos para darles una respuesta. Adicionalmente, en el botón de participantes encontrarán el símbolo de una mano, que al presionarlo se activará e indicará su interés por aportar sobre la conversación existente. En el momento en el que sea posible, la moderadora les dará paso mencionando su nombre para que pueda efectuar su pregunta con el sonido activado. Además, a lo largo del evento aparecerán en su pantalla breves encuestas relacionadas con temas de interés a través de una ventana emergente. Solo tendrán que hacer clic en la respuesta que crean correcta. Posteriormente daremos a conocer los resultados globales con el objetivo de generar debate entre audiencia y ponentes. Por último, les informamos que contamos con un servicio de traducción simultánea en inglés y castellano. Si están interesados en utilizarlo, deben pinchar sobre el botón de interpretación que encontrarán en la barra de herramientas situada en la parte inferior de su pantalla y seleccionar el idioma. Una vez elegido, tienen la opción de escuchar el audio original en un volumen inferior y la traducción en un tono superior. Si prefieren escuchar únicamente al intérprete, cuentan con una opción de silenciar audio original. Para cualquier duda o incidencia relacionada con la evolución del evento, cuentan con la posibilidad de escribir directamente a alguien de la organización a través del chat. Uno de los miembros de la organización contactará a la mayor brevedad posible con ustedes para darles una solución. Esperamos que esta información les haya resultado de utilidad y sin más dilación, damos paso al tercer Innovation Forum de EIT Food. Disfruten del encuentro.
So thank you very much for your attention. We hope that everything was clear. In any case, I would like to remind you that at all moments you can send your questions with any problems and any doubts that you might have to the meeting organizers who will reply to you as soon as possible. Okay, so now I would like to introduce you to Begoña Pérez, EIT Food South Director, who will give you a welcome on behalf of EIT Food and who will also share today's agenda with you all. So thank you, Begoña, and enjoy this session.
Yeah, good morning, everybody. I hope that all of you are nice and peaceful in your desk, in your home. I would have loved to meet you and see your eyes and see your feelings during the day. But we are in this very strange year, changing our ways of communicating, but we have a wonderful team that has prepared a very, I hope, enjoyable day for all of us. November has always been a month for me in the middle of the autumn. It's difficult really to decide what to wear, because at the beginning of the day is quite fresh. in the middle of the day is warm, so it's a bit in the middle of things. But lately I have been enjoying it more and more, because it's the month where we can see the result of the effort of our partners in their projects. We are having the results of the year coming in, and that's why we celebrate our Food Innovation Forum normally in this month, where we can see some of the results achieved during the year. This year, we have devoted this Food Innovation Forum to nutrition. That is really on the top of our minds for these months, because it's more and more related to our health, to our well-being, and so really this is something that it goes very well with the time where we are. We know, all of us, that we have big challenges in front of us, challenges, social challenges, environmental challenges, but specifically, and that's the reason why we know them, especially the societal ones, we have dedicated today to have a deep down on the societal challenges related with nutrition. We know that this sector is feeding an increasing number of people in the world. We know that we have the overweight and undernourished people even in the same city, in the same village, living together. And they are really challenges in our society that we are working for overcome that. So at the same time, I look in the calendar, I said, well, what is peculiar this week or whatever? And I saw that this is the week, you know, we have an international days or whatever. So this is the week in the year for the science and peace. So I said, okay, that is the best of the best. We will do a deep down in the nutrition science peacefully today. So I hope that you will enjoy very much the program that we have prepared. The program will begin. We'll start with obesity, the big pandemic, and how to prevent it. And for that, we are going all the way to Greece. And we have the chair of the European Federation of Dietitians, that Maria is going to join us. Then we will have a roundtable on targeted nutrition, of course, one that has to be focused in COVID-19 and the role that is having in this area. And we will see some results on consumer priorities, on lifestyle behaviors. We have three very knowledgeable scientists telling about that. Then we will have, together with the lunch, if you want to enjoy, that will be 5 projects that will be presented by EIT Food Partners, and what are their first results that they have achieved during this year. And it will continue after lunch, at this e-lunch, with a discussion session on future of targeted nutrition. And we have chosen 3 very important topics that it will be, you know them in the agenda, and will be revealed by another 3 important persons that work in these 3 areas. And last but not least, we will have key speakers, father and son, very specialists from the other side of the Atlantic. That's why we will have to have them just nearly by the end of our day. They will speak on nutrigenomics and targeted nutrition. So this is really our big program. We have prepared with all our care. We have chosen the best scientists that we can find to talk about it. We would like very much that you interact and you use all these new ways of communication for making questions, for try to discuss issues that is in your minds. We have a wonderful team on our back that has been working, I assure you, very hard to have everything ready for you. So I want to thank them and encourage them that to have a very good and successful meeting. And I think that we are ready for going in. I hope that you have tea and coffee with you in your hands and you can enjoy the day. So I give the word back to Afrodita for continuing with our successful day. Thank you very much.
Okay, thank you very much, Begoña. Good morning again. And before we proceed, we would like to share with you a brief survey to warm up and break the ice. So you will see some questions on the screen. So please take your time to answer them. We will leave you a few more seconds. These are some questions on where do you think that targeted nutrition is moving towards to? So we'll give you a few more seconds. And as you can see, we are starting seeing the questions and the answers on the screen. Okay, I think that we can stop voting in 5 seconds. Hope you have had the time to vote. And it's very interesting because we see that there are quite a few of the questions who have significant amounts of vote. So the one that got the biggest amount of votes is that personalized nutrition and individually tailored nutrition, including nutrigenetics. But this has been followed very closely by an option that included all the different answers that were malnutrition and nutrition deficiencies reduction, products customized to specific target populations, prevention of non-communicable diseases, and optimize health or achieve specific goals. Okay, so these are the rest of the answers. I think we will have plenty of time during the sessions today to discuss all these options and see maybe if you've changed your mind after the end of the discussion sessions, the debates, and the different talks that we will having during the day. So thank you for participating. We will be launching more surveys during this meeting and during the day today. And now I would like to proceed to our first talk about pathways to a real change in reducing obesity, who will be given by Lorena Savani, EIT Food Innovation Manager. So good morning, Lorena. We're really looking forward to hearing your presentation.
Good morning, everyone, and good morning. Thank you, Afrodita. So welcome, everybody, for joining us today, and I hope you will enjoy the session, the event. So today, what I'm gonna talk about is, as you know, EIT Food, we are working to improve the health and sustainability of diets across communities. And as all of you know, obesity prevalence trends in Southern Europe continues to rise and shows the highest prevalence of excess weight, reaching well over 30% in Central countries. Therefore, what we have decided to do in partnership with the Spring Food was to perform an analysis of some of the most recent, from 2017 to 2020, initiatives that have been undertaken in Southern Europe countries with the aim of reducing obesity rates, and set out to evaluate their impact, as well as to identify the reasons behind the overall lack of desired success. So this is what I'm gonna be talking about in intervention today. So you see the index of context. In this session, we will be covering the objective and the methodology of the approach, as well as the main results and insights that were gathered and conclusions that were made. So the objective, our goal was to measure the impact of initiatives to know what worked the best in this field. So the indicators that we were looking for initially to understand the impact of each initiative were the impact on obesity, basically, for example, the reduction of body mass index, also the reference to post-program acquisition of healthy habits, as well as data communicated by the initiative sponsors, and the involvement of experts and their opinion. When we talk about the methodology, in order to achieve our goal, we have mapped the initiatives with the generic aim of reducing the obesity, raising awareness, increment the knowledge on the epidemiology or impact of obesity, which have been identified in the Southern European countries, actually with a special focus in Spain, Portugal, Italy, and Greece. Also, additionally, some examples of initiatives from other countries who have been also analyzed for Turkey, Malta, and Israel, and which have been also considered in this analysis. For this purpose, websites and public database of national, regional authorities, such as ministries, municipalities, and health councils, scientific societies, diet and nutrition related associations, and foundations have been screened, among others. No specific target population was considered, and initiatives from both the private and public sector have been screened. And regarding the time frame, in initiatives that has been analyzed were from the beginning of 2019 have been included in this full analysis. So, in order to rate the reach and success of the initiatives, we have classified in a scale from 1 to 4 with respect to measurability and potential impact, as defined in the declarations of their goals and matrix, and the matrix that we have later developed to understand how these initiatives were providing this impact and measurabilities. So with respect to measurabilities, initiatives were classified as follow. So we have the first was initiatives aiming to reaching people through different channels without intention to measure. The second was initiatives that were aiming to generating and distributing trainings, educational material, tools, and creating platforms. The third was the initiatives that were aiming to identify risk factors, perform surveys, questionnaires, and generate touch points with healthcare professionals. And the fourth was the evaluating biometric and clinical parameters, including BMA. I'm gonna make this small. Okay, maybe you're seeing. Yes, so then the potential impact as well has been classified in 4 aspects. So the first was the prevalence of obesity for scientific and public health purpose. The second was increase the awareness. The third, increase as well the awareness of sustained through initiatives that were active for longer than 2 years. And fourth, achieve a decrease in BMA, overweight, or obesity rates for target population. So what have been the results and key insights that we have found? So as you can see, we have in total, reviewed in total 109 initiatives that have been included in the 4 countries of interest: Spain, Italy, Portugal, and Greece. with activity from 2017. This is by no means an all-inclusive analysis, but includes a significant range of initiatives of different types, sizes, targets, duration, and reach in the countries of the scope. Children were the main target population of the retrieved initiatives, which 64 of the initiatives were targeted only to children, while 12 were targeted both children and adults, and the remaining 33 initiatives targeted only adults. Public entities, such as government, municipalities, universities, were the sponsor of most of the initiatives, and 60 initiatives were sponsored by public entities alone. 19 initiatives were co-sponsored by public and private institutions, where, on the other hand, 30 initiatives were sponsored by private entities only. Awareness and intervention studies were equally represented. As you can see, 39 initiatives were awareness, and 30 initiatives included some time of intervention, while 40 were covering both awareness and intervention. Initiatives were conducted in different settings, mainly to the target population. So in which regards school, a total of 37 initiatives were the most frequent setting, followed by the online activities, which were 33 initiatives. Accessibility, educational impact, and involvement of healthcare professionals in the initiatives have been also assessed. So accessible to all refers to the initiatives addressed to any participant with the target population. In this regards, 29 initiatives, which is 26.6%, were accessible to all. And among the identified initiatives, 85 had some educational impact. And 75 initiatives included.
El resto incluían a los profesionales de la salud.
Here, by scoring the initiatives based on the potential impact and measurability, the following observations were made. So it can easily be seen that most of the initiatives accumulate in the center part of the graph, indicating that they have a median value, so scores from 2 or 3 for both potential impact and measurability. This indicates that most initiatives aim to increase awareness by generating and distributing trainings, educational material, tools, and platforms, mainly in school. Only 22% of the initiatives had a high measurability score with 3 or 4. And finally, there were only 19 initiatives, which is around 17.4% of the total, with high scores, 3 or 4, for both measurability and potential impact. So the key insights that were identified through the analysis will be summarized with in the next slides, but here is key that the lack of measurable outcomes among the identified initiatives, almost 1/3 did not communicate or publish any results, making it very hard to evaluate if they had a good impact or not. Therefore, the low measurability and the low impact of the initiatives makes clear that there is an opportunity to redefine scopes of initiatives and establish a good measurement practices and improve Scala. So what is the opportunity? So for the analysis of the information, it has been observed that the well-targeted programs focusing on a specific area and a clear target population can give a better result than larger projects where measurability is an issue. So starting with a pilot approaches allows to better evaluate the possibility of success and scale up only in cases where a positive impact has been observed. So if we make a pilot, we only scale the ones that has a positive result. And this is gonna provide us a higher successful rate. So what are the key insights? There is an opportunity to define key success factors and create a credible and measurable framework for innovation in obesity reduction initiatives. And these can be achieved through the following elements. So define clear outcomes. So define the what we want to achieve, the who is the target population, where, which is the place of intervention. So this has to be clearly defined. Use pilot and learn approach so that we can learn and just scale the ones that work. Define an actionable measurement methodology, for example, through BMI measurement or knowledge acquired on healthy habits, through surveys, etc. Guarantee a good execution. Also have a different mix of players that is leading so to better results. For example, the industry, healthcare professionals, scientific associations. This is going to lead to a much strong outcome of the initiative, and communicate the outcomes. So the places of interventions is also an important aspect. And it's very important that we choose the right settings for actions. So since children are one of the main targets, schools are obviously the priority, but other settings must be also prioritized. So as you can see, schools are the ones that has been the schools and online will be the places of interventions where most initiatives are taking place, but workplace has been very low, so 4.6%. And considering that the people spend lots of time in the days in this environment, most initiatives should be evolved around this workplace. And the same thing about the households should be prioritized, and family in the effort to decrease childhood obesity is key for success. So which is the conclusions of this overall study that was carried out? So closing this short presentation of the work that was carried out, we wanted to summarize the key learnings that can help carry out actions that could lead towards real change in reducing the obesity. So more specifically, efforts should be made towards the following directions. So improve the design of the methodologies of initiatives with a particular focus on measurable parameters, opt for a well-targeted programs in well-defined context with a clear target population, which may give better results than complex all-inclusive initiatives. Also design programs with cost-effective measurement strategy, use the right intervention models so that are affordable, accessible, and that can lead to education, in a optimal place of intervention, and promoting the partnership between different players in the field. So tackling the obesity crisis requires long-term commitment and intervention. And while AT Food, we are working on progress in the development of strategies that can lead us towards the direction, more needs to be done. And by working together, we can continue to improve the diets of our own youngest generations. So thank you very much.
So thank you very much, Lorena, for this interesting presentation. I don't know if there are any questions from the audience. We can check. You are free to ask your questions to Lorena and all the speakers during the different sessions that we will be watching today. So please send your questions through the chat. In the meantime, Lorena, if I can ask you, how do you think EIT Food is now tackling obesity? Can you give us some examples on initiatives or plans that you may have for the future in order to be able to reduce the rate of obesity, especially in Southern Europe, for which you've already presented us all this data about how the problem still remains?
Yes, sure. I mean, at the moment that's why this study was requested, and we wanted to understand why this continuous increase of childhood obesity, despite all the initiatives that are being taken over across Europe and around the world. So we wanted to understand what we can improve to make, to have activities that, to design a proper activity initiative that can lead to a proper, but at the moment, what we are working in AT Food, there are definitely we are doing some works in parts in the communication aspects. So getting to know more, increasing the awareness of the importance of a healthy diet, that this is going to contribute reducing the non-communicable disease. As well, we are working on the innovation projects on having products that are more affordable and that has a better nutritional profile that can help as well prevent these future obesity rates. So we are working with the key players in the industry so that we can, so the different institutions, universities, research institutes, everybody's working. We're working on different solutions to improve as well the overall nutritional aspects of many products.
So thank you very much.
As well as we have different types of solutions like applications and tools that is going to increase the awareness as well. That's going to help also the parents to support their children in having a healthier diet.
Thank you very much. If you have any more questions, you can send them through the chat and we will find the time to discuss them maybe a little bit later. We will continue now with the obesity session. And before we get to our next speaker, we would like to get your answer to a quick question that you will see again on the screen. Please take a few seconds to send your answers, and we'll be discussing them shortly. As you can see, the question is, do you think COVID-19 will have an impact on obesity prevention? Okay.
So good morning. Thank you very much for the invitation. So my talk is going to be on how to prevent obesity in society. I have no actual potential conflict for this particular presentation. And I want to start with some facts, some key facts. According to the World Health Organization, obesity is classified as a chronic and severe disease in both developed and developing countries. And I stress in both developed and developing countries, because we now see an increase, a great increase the last, I would say the last decade in the prevalence of obesity in also developing countries. And it is important to stress that it's affecting both adults and children. This is one publication in 2015, a position statement from the Childhood Obesity Task Force of the European Association for the Study of Obesity, EASO, that I'm a member of this task force. And it was a publication where we actually declared that childhood obesity is also a chronic disease, not only adult obesity, and it demands a very specific care and nutritional recommendations. We also discussed the previous speaker, the prevalence of childhood obesity in Southern European countries that is very high. This is a publication from the COSI project, the Childhood Obesity Surveillance Initiative of WHO. This is a publication of 2010, but the situation remains pretty similar up to now. And you can see that the Southern European countries, you can see it here, like Greece and Italy and Malta and Portugal, have a very high prevalence of childhood overweight and obesity. It is more than 40%. And this is something that has been mentioned by the previous speaker. And altogether, we can see that all over Europe, we have a high prevalence, but as we already mentioned, Southern European countries have a higher, let's call it, problem compared to Northern European countries. So to set the scene, it means that we have a very big problem with both adult and childhood obesity now in Europe. It has been estimated that since 1975, the prevalence of obesity has been tripled. We now know that we have 1.9 billion adults that are overweight, and we have 650 million that are obese. Furthermore, this increased BMI during the last, let's say, 30 years is responsible for more than 2.5 million deaths annually. And this is expected to double by 2030. Again, in 2019, it was calculated that 38.2 million children under the age of 5 were already overweight or obese. So whatever measures we take to prevent and manage obesity should start very early in life. So the question is, how can we prevent obesity? What are the strategies for obesity prevention? Recent studies and reports from all influential health organizations call on policy and nutritional strategies that they will change what we now call obesogenic environment. This is our main, let's say, our main purpose in order to fight the obesity epidemic. And public health experts suggest that policy should be carried out at various levels. It should be carried out at the local level, at the regional level, at the national level, at the European level, at an international level, I would say. Supportive environments and communities, they're fundamental, I would say, in shaping people's choices in order to end up to the healthy choices. And in order to choose the healthy choices, these choices should be the easy choices. And all the strategies call upon all stakeholders in order to take action. So we need a collaboration between all stakeholders. And we need to act, as I said, at the global, at the region, and at the local level. In order to improve the diets of the people, and as we nutritionists say, when we talk about improving diets, we say that we also have at the same time mention and give emphasis to the increase in physical activity at these particular populations. And we have to act at the population level. And let's see some of these policies. For example, here we have the WHO policies and the report of European Food and Nutrition Action Plan 2015 to 2020. And we can see some of these objectives. And when we go on, we'll see that these objectives are common for most health organizations. First of all, the first objective is to create healthy food and drink environment. And of course, there are many ways to achieve that. Second is to promote the gains of a healthy diet throughout life. That means, as I said, that prevention should start very early in life, from pregnancy, and continue during the lifespan. And something that we will see in all the objectives and the proposals of organizations is that we have to give special attention to the most vulnerable groups. Because we do know that the most vulnerable groups are really having higher prevalence of obesity. We have to reinforce health system to promote the healthy diet. We have to support surveillance, monitoring, evaluation, and research. And we have to strengthen governance, alliances, and networks to ensure a health in all policies approach. Since I'm chairing the Nutrition Working Group of EASO and the ESDN Obesity of IFAD, I want to say a few words about the European Dietetic Action Plan of the European Federation of the Association of Dietitians, the UDAP as we call it, 2015 and 2020. This is mainly for the role of dietitians all over Europe and the commitment to action for health improvement through nutrition across the social gradient. And I want to say, of course, to give more emphasis on prevention of obesity. And I want to show you the similarity, as I said before, with the objectives of WHO, because all health professionals have the same objectives. So the main objectives of UDAP is to ensure that healthy food and nutrition is accessible, is affordable, is attractive, and is sustainable. And to promote these gains of healthy diet and nutritional support through life course, especially again of the most vulnerable groups. I want actually to show you all these similarities in these objectives. The difference between this and the previous one is that the dietitians give a lot of emphasis in the clinical setting, and this is important now for COVID, because the dietitians are now having a number of new reports I'm not going to talk a lot about COVID because I've seen in the program there's a special session for that. My presentation is mainly on prevention, but I want to tell you that if you want to get some information about the role of dietitians in the prevention and the nutritional, let's say, prevention for COVID, and as well as treatment of patients that have already had COVID, you can go to IFAD website and get some information, especially in the clinical settings, where I think it is very important, the role of dietitian. So what UDAP actually emphasized is the role of dietitian in clinical settings, not only for COVID, but for other diseases, for example, diabetic patients or patients with hypercholesterolemia, etc., and the community. And my talk today is mainly for the community. And when we go to what we can find written in UDAP regarding prevention of obesity in societies, we can see that it says to improve food consumption and prevent obesity, and prevent obesity-related prevent obesity. I'm very sorry. Yeah, to improve food consumption and prevent obesity. Related food nutrition policies, all the policies we develop, would aim to increase the availability, the affordability, and the acceptability of healthy food choices, and on the other hand, to decrease all this for the unhealthy food choices in various settings. And now we go to the different settings in the society that we have to work with: the home, family, the school, the workplace, and the community. Now it is important to see how the food environment is affecting our food choices and affects our healthy weight. We can see there are different visualizations and definitions about the food environment. This is a visualization from Turner and colleagues, published in 2018, that it actually shows that food environment is part of the food system. In the food system, we have the production of foods, the storage, the transformation, and transportation. And we do have the food environment that I'm going to say a few words about it. And then this affects acquisition and consumption of food, and of course it affects health and nutrition outcomes. So if we improve our knowledge and understanding of the food acquisition and consumption practices, this will help us to design better intervention and policies. We discussed about intervention and policies before, but it is very important to understand how environment actually help us improve our food security, and also improve our nutritional habits and our life habits in general. And this, at the end of the day, will help us to tackle obesity in all the forms. So you can see here in this pretty, I would say, complicated diagram, that in the food environment, we have what we call an interaction between external and personal domain. And in the external domain, it is important to discuss about availability of food, about prices, about vendor and product properties, about marketing and regulation. And of course, we could have a separate talk for each one of them. But then we go to the personal domain, and we do know that there are factors that are very important, and this food environmental factors are very important nowadays also during sometime lockdown. I would say during lockdown, that we have lockdowns in different places in Europe nowadays, the quarantine, where accessibility is an issue. Affordability of food is also an issue, especially for the vulnerable groups. Convenience is also important. And then in our everyday life, we shouldn't forget desirability, our preferences, our desires, our cultural differences, and all this, they make what we call the food environment that is part of the food system. And I'm showing that to tell you, to let you know that all the strategies for prevention and treatment and management of obesity are not simple ones. So what about the nutrition food policies we can develop? First of all, in the different countries, we do have what we call the dietary guidelines. And I will discuss a little bit about the dietary guidelines, the national dietary guidelines in a minute. We do have a lot of discussion in Europe about labeling, the nutritional labeling for food packages. This could also be a separate presentation. And as I said, there's a lot of discussion nowadays, and I think we could collaborate with the food industry a lot to end up with a nutritional labeling system for Europe. There is a discussion about labeling for food providers in restaurants. Well, I'm now taking part in a European project that we're discussing of all the menus provided by different restaurants, and we're trying to develop a system of nutritional labeling for foods provided in the restaurants. And we're also trying this, this is called Protein, this particular European project, and we're also trying to develop a special app that you could use when you go to the restaurant, and then you could probably find out by taking a picture of your meal, of the nutritional value of your meal. Regulation of food marketing, this is very important, especially the regulation of food marketing for children. There is a very good report, WHO report, about the regulation of food marketing for children. Different economic policies that are related to food prices, taxation, and subsidizing different healthy foods. Taxation has been applicable in certain countries. We've seen the sugar sweetened beverages tax in UK, and we do have some good first publications about the impact of that. We do have the school-focused nutrition policies. We already heard a little bit from the previous speaker, and of course, community-focused nutrition policies. These are some examples of the of different countries of dietary recommendation, dietary guidelines, as we call them, or nutrition guidelines from different countries. You can see examples from the Nordic countries. You can see the Greek guidelines. You can see the Australian ones. So every country is having nutritional guidelines. And the difference between the, what we say, this type of guidelines and strategies is that these guidelines, of course, they are giving, let's say, the principle for a healthy nutrition to the population of this particular country. But when we're talking about strategies, we also include other strategies, as I mentioned before, and not just guidelines. And these are examples of dietary guidelines and recommendations for children. And you can see again the guidelines of the different countries. These are the guidelines for children for Greece. I'm participating in the National Nutrition Advisory Committee in Greece. And it took us many years to end up with these new guidelines that now they are national guidelines and you can have been accepted by the Ministry of Health. And I believe it's a similar procedure in all countries. In this short presentation, I would like to spend some time to talk about a little bit about the European joint action to contribute to halting the rise of overweight and obesity in children. This is the JAMPA project. It started in 2015, and in Greece we participated. Most countries, as you will say, I will say in a minute, participated in this JAMPA project that was responsible from the Greek side. We started in 2015 and we ended in 2018. There were 25 countries participated, 39 institutions, 13 collaborating stakeholders. So it was a big project with a lot of, let's say, ambitious our purposes, let's call it like that. Like we wanted to assess the cost of childhood obesity in different European countries. I wouldn't say we succeeded, but we progressed a lot because it's a very difficult job. We also, in Work Package 5, we aim to get all the information around Europe for nutrition reformulation. But I want to spend a few minutes to talk about the Work Package 7, where we actually looked at the contribution. Actually, we looked at methodologies for healthier childcare, and we actually look at the strategies in different European countries regarding mainly mainly healthier nutrition strategies in families, in kindergartens, and in school in the different European countries. So we decided to have a life course approach for healthy diet and physical activity in children, because as I said, we all agree that we have to start very early in pregnancy and early age. We also decided that all the policies that would be effective and intervention, they could be multi-sectorial. We should have a multi-sectorial approach. Actions between the social, employment, educational, health, agriculture, transport, and private sectors. Otherwise, we cannot succeed in, let's say, an efficient intervention. Again, in JAMPA, we realized that we have to pay emphasis in the social inequalities in terms that we have to look at the vulnerable groups. And this was a very crucial aspect of this project. And this is a recent publication that I think I thought it was important to show in this talk about prevention of obesity, because this shows, let's say, a policy of assessing interventions. Because what is happening now in Europe is that each country, of course, has interventions, some of them very successful, but at the end of the day, we don't have specific criteria to assess the effectiveness of an intervention. And this is what I wanted to show you out of this JAMPA project. Of course, you can go to the JAMPA website. There are a lot of, I think, good publications regarding prevention of childhood obesity. But I wanted to show you this particular work out of the whole JAMPA project, because I think it is, at this stage, we have to have very good criteria of what we finally, when we finally assess an intervention. And in this particular publication, we published some criteria, good practice criteria for childhood obesity prevention programs in kindergartens and schools. So everyone that has a program could use this criteria to see how successful this intervention and this program was. The key points, therefore, of this publication is to identify the good practice criteria, so the users could assess to what degree a program or policy incorporates conditions and attributes that may contribute to effectiveness. So make our programs more effective, because we are at a stage that we have so many different programs running, but how effective are these programs? And if we say it is effective, who's going to judge and under what criteria? So this is something we try to develop in this particular program, and this is especially for kindergartens and schools, but I think it could be helpful for other interventions. And of course, adaptation to the local content is essential when we talk about the impact of childhood obesity. At the end of this presentation, I also want to spend a few minutes to talk about a recent joint paper between the Nutrition Working Group of IASO and the ESD and Obesity of IFAD on the dietary management of obesity in adults, pitfalls and opportunities in Europe. You can find this report, the complete report, in IFAD website. Part of it that is related to a survey we did with the dietitians in IFAD. We had a survey in the dietitians in Europe to ask them what dietary recommendation they use when they treat their obese patients around Europe. And we also asked them what were the goals and what were the experiences in the different environments they are working. So this particular part, the survey, it was under publication. The European Journal of Clinical Nutrition is going to be published in the next few weeks. And also there are two parts in this particular report. One is related to prevention and one is related to treatment. The one related to treatment is under publication. Again, it's going to be published in, it's going to be two different papers. One is going to talk about management of adult obesity, and the next one will be management of childhood obesity. So we're going to separate our work in prevention and treatment. So I see that I'm already talking about 26 minutes. So this are just, if you're interested to read this paper, please visit IFAD website. And at this moment I will stop, so I'll give you some time for questions. And I want to thank you very much for this opportunity to give this presentation. Thank you very much.
Thank you very much, Professor Hasapido. This has been very interesting. So let me start with a series of questions that we have received so far, just to let you know that you can still send your questions. So let's start. Why do you think that Southern European countries, home of the Mediterranean diet, are so much affected by obesity?
This is a question I like to answer, because this is something that we have been working on and trying to figure out why we have this increase in, this is a higher prevalence in the Southern European countries, although we have the Mediterranean diet and one would expect that we have a lower prevalence. One of the answers, I don't know if it's the only one, but what we've been discussing with my colleagues in different, Southern European countries, in Spain and Italy, etc., and we came out with an answer that unfortunately, the Southern European countries are not anymore following the traditional Mediterranean diet, and the last, let's say, 20 years at least in Greece, we've seen changes in the nutritional habits of Greeks, and we've seen similar changes in Spain and Portugal. So it's a more Western type of diet, I would call it like that, an increase in consumption of total energy, decrease in physical activity, as well as increase in consumption of saturated fats and simple sugars. Finally, I could tell you, because we have some very good results of the COSI program, the Childhood Obesity Surveillance Initiative of WHO, that children in Greece, in Portugal, in Spain, unfortunately, they have a lower physical activity. For example, we have a very good question in a questionnaire we are giving to the children in school. We're asking, how do you go to school? And more than 50% of children in Greece, and I would say here, Cyprus, Malta as well, Spain, Italy, Portugal, they go to school by bus or by car. Parents do not feel that the roads are safe, and they just, something like 1 or 2% use a bicycle for school, compared to the Northern European countries, that the results are exactly the opposite. More than 50% of children, they either walk or bike to school. So this is an example of what is happening in our countries, as well as I told you, changes in the nutritional habits.
Okay, so let's carry on. Do you think that personalized nutrition, which is the scope of most of our discussions today, can be part of the answer to tackle obesity?
Yeah, the protein project I mentioned before, and please go and visit the protein website, is an EU project I'm participating. I'm representing my country in this project. Is actually on answers this question, because we're trying to find out exactly if more if personalized nutrition and precise nutrition, whatever you want to call it, will help, because we're getting a lot of information regarding genetics, regarding microbiota, and at the same time, we try to relate this data to nutritional data and data on physical activity, and see how, at the end of the day, we can personalize the diet, and this will help us probably, we hope so, to the prevention, but mainly for the treatment of obese individuals. I think personalized nutrition is very important for the treatment. And prevention, I told you, is different, the strategies and all this, but when we are talking about treatment, yes, I do believe that the more personalized the diet is, the more able the health professional will be to really give better nutritional advice.
Okay, thank you. So we have another comment/question. Nowadays, convenience is key. So one of the solutions to fight against obesity is healthy and affordable, ready-to-eat fast food that would allow to, for example, follow the Mediterranean diet, as we have mentioned. Do you think that this type of approaches could have a positive effect on tackling obesity? Healthy and affordable, ready-to-eat/fast food?
I would say that healthy and affordable is really something that we're looking for. Let's start by that. If a fast food can be healthy and affordable, I would agree. This is something you would allow me to question, but I do agree that if we get there, this will be really helpful.
I think it's most important now to give welcome to the speakers who will be presenting during this session. So we have the pleasure to have with us today three great speakers. To start with, Dr. Riccardo Caccialanza, Director of the UFC Dietetics and Clinical Nutrition at Fondazione IRCCS Policlinico San Matteo Pavia in Italy, who will talk to us about the role of targeted nutrition as recovery in COVID-19. He will be followed by Professor Ana Lucia Silva, professor at Instituto Politecnico de Leiria and at Instituto Piaget in Portugal, and the Nutrition Sciences and Health Promotion. So Professor Silva will talk on lifestyle behaviors and COVID-19, a chance to change. And then we will close the series with Dr. Laura Laguna, researcher at the Institute of Agrochemistry and Food Technology in Madrid, Spain, who will talk on the impact of COVID-19 on consumer food priorities. After the three talks, we will have a discussion session. So let's start with Dr. Riccardo Caccialanza, and we'll be back to you shortly.
Well, as you can see, as you know, in the first days of March and April, we experienced this dramatic emergency situation, which unfortunately is still going on. And it was like the start of a war, and all our hospitals were on a very hard crisis. And as a nutritionist and as a clinical nutritionist, we immediately thought that we had to do something, because we are aware that any disease is affected by malnutrition, cachexia, loss of muscle, and the imbalance between fat mass and fat-free mass. And so we know we have a good experience in cancer in particular, but we often collaborated with our infectious disease specialists. So in those days, we really had to think of the best strategy to treat our hospitalized patients. And so it was very challenging and very difficult, because we had no specific data from the literature, because it's a new disease. And we had no time. We had no time to wait for the guidelines, which was released in the following weeks by the main clinical nutrition societies and anesthesia and ICU societies. And so we straight went for our protocol, which was a pragmatic protocol, of course, because we had no chances to have clinical confirmation, scientific confirmation, but we were experiencing admission of many patients with severe inflammation at admission and anorexia, leading to a dramatic and immediate reduction of food intake. And a substantial percentage of these patients were developing respiratory failure, requiring non-invasive ventilation, and so it was very difficult to feed these patients. It was a straight protocol. We know that it can be debatable. It has to be debatable because we were not strictly on the guidelines because of the emergency scenario. And so in our protocol, we tried to start a systematic supplementation for all patients with whey protein, 20 grams a day at admissions. And we provided all patients with multivitamin, multimineral, and trace elements intravenous solutions. Then we add the dosage of vitamin D at admissions, and we prescribed and we gave patients these amounts of vitamin D, 50,000 units or 25,000 units per week according to basal blood test levels. And then we simplified our nutritional screening tool because we know that it was very hard to obtain, to weight the patients in those days in that scenario. And so we asked the nurses and the medical doctors in the COVID wards to try at least to have an idea, to give us an idea of the patients, to ask these very simple questions. And if patients were detected their nutritional risk, we started immediately a supplementation with high protein, high calorie oral nutritional supplements. But we asked nurses and doctors to try to monitor food intake of these patients and the tolerance to oral supplements. And if the patients were not able to consume the supplements and to eat for 2 consecutive days, or respiratory conditions were worsening, we asked them to contact us in order to start with immediately parenteral nutrition according to blood test. The rationale of our systematic supplementation relies on the fact that we are aware that whey proteins can have anabolic antioxidant properties, and they already exert the potential clinical benefits in cancer patients. They have immunomodulatory properties and potential antiviral activity, which have been already shown for HIV during antiretroviral therapy. We are aware of the importance of vitamins and multimineral solutions. So we know that they have antioxidant properties. Of course, we acknowledge the limitation that we can't have the basal blood test for all the vitamins. And we know that it was not a precise approach, but the literature supported us in letting us know that we had to avoid vitamin deficiency. And particularly, we had to avoid vitamin D deficiency because it has been studied in the last months, and we know that it's very important for the immune system. So we know this was our rationale, our approach. We are aware that the main problem, the main debate can rely on enteral nutrition. Why we didn't start immediately with enteral nutrition? But we know that we experienced lots of difficulties in the management of enteral nutrition in those days. We know that nasogastric tube may result in air leakage and compromise the effectiveness of mechanical ventilation or CPAP. And so it was very hard to choose for us. We know that many patients with antiretroviral therapy were experiencing diarrhea. And so even if we are well aware that our approach was not perfect, that's what we chose to do. And there are many critical issues and open questions and perspectives in this kind of nutritional approach for this disease. First of all, we are aware that the accuracy of nutritional assessment should be improved. We were not able to perform calorimetry to have an idea of body composition. I don't know if the situation maybe in Europe is a bit improved, but it's still critical. So I don't know if we can rely on precise information when approaching nutritional support in these patients. And at the same time, underfeeding is very hard to avoid for different reasons. First of all, the number of admitted patients is increasing again, and so it's difficult to guarantee the appropriate nutritional treatment and care to all the patients in the wards which are opening again, and it's coming back in emergency.
Cada vez más complicado y está siendo un problema urgente. Muchos pacientes no tienen una línea central. Luego, la nutrición parenteral no puede ser siempre aplicada y puede ser difícil de gestionar.
So where in the hospitals where you don't have a clinical nutrition unit, and still can be problematic provision of supplements, enteral formulas, and parenteral nutrition bags or infusion pumps. So these are the main problems. Very briefly, and I close my presentation discussing very briefly the vitamin D issue, which is very, very interesting. We are studying it. We have two studies. One is a short review, which has already been published, and we are on clinical nutrition, our personal experience on the first 129 admitted patients. We observed a dramatic deficiency in vitamin D at admissions. But in our experience, it was not related to the severity of disease, mortality, ICU admission. There are many problems, methodological problems, because we have to be aware that vitamin D is related to the inflammatory status. So it's difficult to interpret all the studies which are coming out. In my personal view, I think that the vitamin D deficiency is widespread. And we are now aware that vitamin D has a key role for immune function, for bone health, for cardiovascular health. It can be helpful in preventing also some cancer. So my advice is it's not the magic bullet, but it's very important to avoid deficiencies. And so most of the patients and most of the population, in my view, should be supplemented. To conclude, I think that we are in a very difficult situation. As a nutritionist, I believe that nutrition is a key point for the health of the general population and for the health of sick patients who ask for appropriate treatment and support. So in my view, we have to do any effort to try to guarantee adequate nutritional prevention to the population and support to sick patients, because now it's time to acknowledge in a definitive manner the dramatic consequences of malnutrition in every setting, in every disease. And so I think that we have to try to find a good connection to improve the evidence with multi-center studies and to try also with this kind of initiatives to make more clear that nutrition needs and deserves proper treatment and proper investment, because we need more people in the hospitals to deal with this fascinating and very important discipline. And thank you for your attention.
Thank you very much, Dr. Caccialanza. I think it was very interesting. So I think now we can proceed to the talk by Professor Ana Lucia Silva. Sorry about the complications previously. So Professor Silva will be talking to us about lifestyle behaviors and COVID-19, a chance to change. In the meantime, you can send your questions to both Dr. Caccialanza and during this talk to Professor Silva, and we will have the chance to start the roundtable discussion right after the third talk. Thank you very much and enjoy the second talk.
So I'm very happy to be part of the third Innovation Forum on Food, and my presentation is about lifestyle behaviors and COVID-19, a chance to change. As we all, let me, just 1 second. As we all know, COVID-19 is infecting and affecting millions of people worldwide, and as a consequence of the World Health Organization declaration since the beginning of March, COVID-19 crisis has increased the unemployment, the income insecurity, and changes in food supplies. which will impact on malnutrition, along with increased food insecurity for the large proportion of those who live in lower and middle income families. Of course, the vulnerable groups are at higher risk for their unoptimal nutrition. And for example, in some countries like Portugal, we are now delivering food baskets for free. The resilience of a country might be seen by the nutritional status of its population. So it's very important that national and global policies protect the food environment in order to guarantee quantify quality, diversity, and safety of population's diets, in order to improve nutritional status and optimal nutrition, and further positive health outcomes, which will impact positively social, economical, and environmental. The impact on jobs and incomes has increased the number of hungry people, and nowadays 2 billion people are in nutritional deficiencies. 49 million people will be pushed into extreme poverty that will affect 270 million people being acutely food insecure by the end of this year. This is an increment of 82% from before the pandemic. And we all know that 1% loss in the growth development product will affect 0.7 million of stunted children. On the other hand, 2 billion people are worldwide overweight, and we know that lower income associates with unhealthy diets, which might pose more people in a critical overweight condition. At the end of the lockdown, people became panicked to buy and stock up on food. There were some difficulties to shop for fresh groceries and shortages of certain food products. And despite very unlikely, people were afraid that suppliers will eventually run out of household essentials. So it's very important to any country to protect food producers and flow fresh products from the farm in order to prevent the wasting food. We can see by comparing April from 2019 with April of this year that both imports and exports contracted, especially in Europe, North America, and South America. This might be related to the shift of a more home-based eating away from restaurants and other public eateries. So it's very important for countries to counteract nutritional deficiencies of energy, protein, and in some specific micronutrients like iron, zinc, and vitamins A, E, B6, and B12 that we all know that are associated with depressed immune function and an increased susceptibility to infection. Countries might also minimize the difficulties in food accessibility, raise local agricultural production, and minimize the food imports. Also, the countries must control wage taxation for staple foods and commodities. A recent meta-analysis showed that individuals with obesity are at higher risk for COVID-19, and pooled data indicate 46% at higher risk for COVID-19. Also, there is an increment in the risk of hospitalization and more likely to be in the intensive care. The comorbidities and depressed immune system seem to be the causes behind this higher risk. However, the mechanism behind the severity remains unknown. During confinement, it was very interesting to see that from the search on internet, that people were more interested for cook or for recipes, and like how to make buttermilk, or how to make cocktail pins, or how to fold a cereal box. and this might indicate that people are cooking more during confinement. We do know that lifestyle behaviors tend to cluster and associate each other. For example, mental well-being negatively associates with dietary behavior and sleep behavior, and also life satisfaction negatively associate with diet and sleep behavior. On the other hand, physical activity positively associates with mental well-being and life satisfaction. So there is a few indicators that these behaviors tend to cluster each other. So let's see what we do know about the current lockdown. There's a disruption in most daily activities, which will influence the lifestyle, especially on diet and physical activities. There are limited participation in the normal physical activities, and also an increment in anxiety and boredom, which are risk factors for consuming more food and more food of poor quality, and also less sleep quality. We all know that all of these factors are related to a positive energy balance. However, limited evidence to analyze and evaluate the effect of the lockdowns and the restrictions associated to the lockdowns and to the COVID-19 on changes in lifestyle behaviors. However, there's a few outcomes today, but the results still inconsistent. What we saw about the sales, that there was an increase in sales for staple foods, processed fruits and vegetables, and a decrease for fresh fruits, dairy and meat, which probably are related to sales for restaurants, schools, or the tourism sector. Also, we saw an increment in the e-commerce. For example, in Portugal, more 70% of people were buying on the internet during from January until August. And we have now some evidence showing that from Africa, Asia, and Europe, that adults had worse dietary behaviors, such as were more likely to have an unhealthy diet during the lockdown, or have found yourself being eaten out of control and snacked more. On the other hand, and by opposition, Italian people showed an increment, or showed that they decreased the consumption for snacks or processed meat, sugary drink, and from the at the age range of 18-30 years old, there were higher adherence for the Mediterranean diet. However, 34% self-reported an increased appetite, and almost 50% perceived weight gain. Curiously, 15% turned into farmers or organic for fruit and vegetables. In Spain, there was an increased consumption for unhealthy foods. However, the adherence for Mediterranean diet increased, and almost 50 self-perceived a lack of weight gain. So they reported a weight they reported that maintained their weight. They increased homemade baking, and in Portugal, this is just a report. It's not published already in the scientific community. However, 58% of population reported a change of diet for better. 57% increased home cooking, 30% snacked more, and 26% self-reported weight gain. This is it's quite problematic that 8% reported economical difficulties in food accessibilities. As regards to physical activity during confinement, the data indicated that there was a decline in days in minutes per week spending in physical activities. So people spent more time under sedentary behaviors, and same result was obtained in Italy. However, at the highest levels of physical activity, there was an increment, and also in Spain for the 6 or more times per week spending in physical activities, which probably indicates that those who were physically active increased the activity during the confinement. In Portugal,
Silva, I'm sorry to interrupt. We just need to be wrapping up to give time to the next speaker. If you can just use this last couple of minutes to finish your presentation. Thank you very much.
Thank you so much. So Portugal, the same trend, we get less active, and it seems that search for exercise was mostly done by YouTube. So to finish my presentation, nowadays there are approximately 600 apps in medical health in the market, and I would like to alert for internet and communications technology, which came to stay, allowing patients to receive care at home, providing greater control of their health, well-being, and promoting healthier lifestyles and well-being. However, I would like to highlight the barriers for technology, for example, for older ages. So I finish here my presentation. Hope it was a start for critical thinking. Thank you for your attention.
Thank you very much, Professor Silva. And I think to finish this series of presentation, we can now introduce Dr. Laura Laguna, researcher at the Institute of Agrochemistry and Food Technology in Madrid, Spain, who will talk about impact of COVID-19 on consumers' food priorities. Dr. Laguna, whenever you want.
Hello, so thank you very much for the lovely introduction. My name is Laura Laguna, and I belong to the Institute of Agrochemistry and Food Technology that in the same time belong to the Spanish National Research Council. And my institute, although the central institution is in Madrid, is in Valencia. So I'm so sorry for my other mates of CISAC, but I can see the Mediterranean Sea from here. So today, I'm going to talk very briefly about our findings regarding the impact of COVID on consumer food priorities. So more or less, my colleagues were already talking about where we were in 2019, if someone can remember, that we began to see new cases of pneumonia that were later identified as COVID-19. But it was not in March where the World Health Organization declared a state of pandemic, meaning that it was a disease that it was occurring in a wide geographical area. And as Dr. Cachalanza was explaining, this set in motion a whole research world wanting to understand the origin of the disease, how was this virus, and also an incredible effort by the healthcare to try to see how can cure, help this disease. However, as Dr. Silva was pointing out, not only our health was being affected. The different measures, as the social distancing, the lockdowns, were changing our routines, lifestyles, concerns, and knowledge. And what we wanted to know is how those changes were affecting the way that we ate. However, being in a lockdown, it was a little bit difficult. Sorry. As I don't know if you can see, I can see myself, but I hope that you cannot see it. That's okay. So to do that, to capture these worldwide changes, we began to do some worldwide studies. For one way, we look into internet searches that we did worldwide. And then we also study the most watched videos as well as Twitter And in the national level, we could work better with an array of online questionnaires where we ask about where were the shopping changes, the motivational changes that drive this shopping, and where were the trusted source where consumers were having the information. Regarding the internet searches, we use a tool that is called Google Trends that I'm sure that most of you know. And we did different searches, from our beginning worldwide and then also in Spain. So we play a little bit not only with the locations, but also with the languages. So as you can see in both, there is a constant line that is the food. As we can know, food is a constant search. However, when we put the word COVID and symptoms or spread or lockdown, we can see that there is a spike or March on both situations at national level and worldwide level. And regarding the food, although it was constant, as Ana Silva was explaining, it was some foods that they were searching more than the others. For example, we have the flour, bread, eggs were searching more than other foods, and that was related exactly with the previous talk because people were baking more at home. Also, we found that banana searches spiked since March, and that was related with false hoaxes or fake news saying that banana can have a protective power against COVID. The same was with some fruit that it was mainly citrics about that can prevent this COVID. And unfortunately for nutritionists or dietitians, the searches and interest of diet plummeted down with the arrival of COVID. When we analyze the videos, we observe which were in different languages, in Spanish and English, the videos that were most watched when we put COVID and food on COVID and shopping, and we analyzed different things, and we saw that the videos most watched were mainly news, some advice, and documentary, and the topics that were in these videos were regarding the viruses and the origin, the quarantine, and how to do the purchasing storage. And also, unfortunately for science, we were not the most famous or loved speakers on these videos, but were the influencers that unfortunately helped to distribute some of the fake news that was happening. For example, at the beginning, we were surprised about how many false advice regarding honey and regarding cinnamon and ginger to prevent that the virus stuck in your throat were. Also, we use the social media to know worldwide what people were saying, and we know when people receive information, it has an impact, and this impact, it can be reflected in a way with the things that people is saying. So for that, we analyzed during the months of March and April the tweets in different language, 37,000 tweets in English and 40,000 tweets in Spanish, and we will observe that it was an evolution over time of these topics. So first, at the beginning, well, in the middle of March, we saw that the most talk in Twitter was about the best way to buy food and store. You know, people were sharing advice if you go in the morning or you have to buy more toilet roll, about health. We also found that some of the messages like stay at home were really working, but only for a period, for a week, how to do the social distancing. Also, they were very concerned about deaths and the number of deaths. And then as the pandemic status evolved, the concerns about the impact on the government, the management, the impact on the economy, the management of the government began to rise. And at the end of the study, that was mid-April, the main topic that was on Twitter was regarding the economic crisis that was coming. Then at national level, as I say, we did an online questionnaire that it was a very small sample, so we cannot say that it was representative of the whole country, but it was just a pilot study. And in this pilot study, we did an online questionnaire where we asked people which food they were buying more or less, and for each food, what was the motivational change. So we found, using correspondence analysis, that vegetables, pasta, nuts, cheese, and chocolate were bought more because they believed that it was healthier and this make them feel better. However, fish, seafood, and bakery goods were buying less because fish and seafood were very perishable and they couldn't go out as much as they wanted. And regarding bakery foods, baking goods, and some other sweets, they didn't think that it was good enough, and that didn't make them feel better or cheer them up. Regarding the statements and informants, we make a mix between the World Health Organization statements and something news, and we realized at that point in March that people have clear that they have to wash their hands with soap. They didn't have to go out except some exceptions. However, there is some things that they didn't have it clear, maybe because the scientific community didn't have it clear at that point. Like, for example, if it was good or not to take vitamin D, or if they have or not to eat more citric fruit. And regarding the sources, when we asked them, they said that the most reliable were the researchers and the health staff. However, as we saw in the beginning, influencers were having more impact than researchers. So some message that I want you to take home. As I said in the last slide, people declare that scientists are experts as one. They are the most reliable source. However, when they have to search for videos and watch videos, scientists, we are not the most popular. And some messages we could see that work for a time and it disseminates a lot. However, we have to find more messages that can promote healthy habits even during this lockdown. Regarding the social media and internet, it was good because people gave the opinion without being questioned, so they didn't feel that they have to make happy the researcher or the interviewer. However, the information is indirect because we don't put the question but get the information. And also to know, I didn't show it here, but with the adequate tools, the social media information allow us to travel in the past to see what a consumer has said in the past, and we can in that way learn even more about the consumer, what they really understood, where they got the information. Also, the searches can reflect the concerns and interests of population. And for example, I have here the searches about diet and food in 2019 and 2020. And as we can see, people has a lot of interest, a lot of searches in diet and in weight loss. However, the searches of healthy food and physical activity are extremely low or even none. So I would like to find how can we shift those interests, you know, that the diet comes with healthy food together. So thank you very much for your attention. If you want more information for the studies already published, I want to thank all my co-workers that have helped me to do this work. And also you have to know that thanks to Amparo Tárrega in our lab, we are in a project with AET Foods, still studying the COVID response, absorption, and of underspending. So thank you very much for your attention.
Thank you very much. I think it was a very interesting presentation as well. So as you may remember, right before we started this session, we shared with you a question: how do you think COVID-19 has impacted on the targeted nutrition area? Let's start by discussing a little bit the answers that we received. So there was a draw between the option, it has helped to study more about prevention of non-communicable diseases, to establish correlation between NCD and infectious diseases, and between it has delayed studies or ongoing research, since all efforts have been focused on COVID research. So I think that the obvious question with which we can start now is, what do you think is the reality? We have the two opposite opinions. One say that it has helped to study more about the prevention, and the other one that it has delayed studies or ongoing research. Do you think that there is space to accept both options? I think this is an open question to all participants.
Okay, so for me, both. can be complementary. It's true that when COVID arrived, we had to stop everything that we were doing and find new ways to research, because we were not allowed to go to the laboratory. And in that way, it has affected other research. But now I think we are finding the balance to keep our research, or people to keep their research, whilst we are still trying to help the COVID situations.
Mhm.
I can, in my view, I agree with Laura, but above research, there is a huge problem with the clinical care of other diseases. Screening programs for cancer have been delayed, and surgical operations for cancer have been delayed. So I think that we will pay
Vamos a pagar
in the next 2-3 years. So it's not just research, and we have to find the balance, not only on the research, which is fundamental for improving clinical care and whatever, but for giving the right access to the patients with other diseases. We really had to make any effort to find a balance. Otherwise, it will be tragic in any case.
Okay, thank you very much for these opinions. We have already quite a few questions from the audience, so I will start with them. Please feel free to interact among yourselves. If there's any additional questions, we will try to address them. Let's start. Is it all about supplementation of nutrients or diet adaptation when we talk about nutritional management or nutritional support in the context of the COVID-19 pandemic? It's an open question to whoever wants to answer.
I would like to answer, but however, I'm having some problems with my camera, so I think you are not watching me.
No, we can't see you, but we can hear you very well.
Okay, so I think the next step will be focus on global health in order to build a suitable and equal health care systems. However, internet and technologies might be aligned for individual nutrition. So there might be a global support and also at the same time individual programs.
Yeah, I agree with Anna. Particularly, supplementations as relevance, clinical relevance, if it's targeted on the single patient. So it's not just a question of supplementation, giving every vitamin to everybody, but it means to improve the quality of dietary pattern. Diet is a part of lifestyle. It's not just you eat an apple or you avoid meat. It's something which is more complex than we know, but which we are studying, and it involves multidisciplinary efforts to find a connection between microbiome and eating patterns. But it's not just a simple focus on use that supplement and you are fine. It's and of course you have to implement also physical activity and healthy lifestyles in general if you want to improve health at a global level.
So coming back to the topic of supplementation, it has been a lot of discussion recently about the importance of maintaining adequate vitamin D levels. Do you think that maintaining these correct vitamin levels is really important in preventing COVID-19? Would it be one of the most important nutritional approaches?
Well, of course. Well, we have indirect evidence at the moment. But the number of studies are increasing, and unfortunately, there are very few intervention trials, but luckily they are published. But there are some of them, particularly in the UK, which are going on, because if you have a causal effect, if you want to see a causal effect, then you need an intervention trial. The one which was recently published in Iran, I think, was positive because patients who were supplemented during the hospital stay were improving. On the public health view, I think we have to really make any effort to avoid deficiency, not just for COVID, but in general for the global health of the population. Countries in the north, in Northern Europe countries, have started a supplementation policy. In Israel, governments are recommending vitamin D supplementation to the population. So these signs are important, and we have to remember that it's really cheap. It's nonsense. It's really, really cheap. And so I think it should be very important. We have to wait for more robust data, but in the meantime, it doesn't cost anything. Avoid deficiency. It's better for bone, infectious, cancer, cardiovascular health. So I really recommend for that.
Thank you very much. I don't know if anyone else wants to build on the vitamin D topic. If not, we can move forward. Perfect. So another issue, what is the real situation regarding the risk of the present pandemic on severely affecting mental health? And is nutrition one of the ways we can use in order to mitigate this risk? We know that it's been a challenging period for the population worldwide. So can we use nutrition? Is nutrition one of our tools in order to fight the potential effects of COVID on mental health?
Okay, so I've studied quality of life, but in adolescents, and we saw that the physical well-being were positively associated with diet. However, that relation was not actually a cause-effect relationship. It was because those who were physical activity, of course, were those who reported higher physical well-being. So I think it's necessary to search more on the relationship between mental health and dietary behaviors. However, there's no doubt that a few in specific micronutrients or carbs are related to a better emotional feeling. So I think it's better to approach mental health directly, and there's more variables behind the mental conditions than diet itself.
I perfectly agree with Anna. I would like also to add that there are some evidence on omega-3 supplementation, which can be helpful in preventing or improving depressive symptoms. But I think that paradoxically, this pandemic could be also a good opportunity to improve and to spread nutrition education, certainly also to mitigate mental health problems, or at least to limit the damages which mental health problems can have on nutritional status and global health.
So who do you think should lead these efforts to guide the population on the importance of proper nutrition, and in some cases of specific nutrition supplementation, in order to be able to reinforce our health state now that we're facing such a big challenge as COVID-19? Is it the role of the different governments and authorities? Is it the role of the scientific community, of the industry, of partnerships among all these players?
May I answer?
Of course.
I believe that it has to be a joint effort. Obviously, the government, science, and clinicians cannot work separate. If we manage to work all together and to recommend together, probably the government can give the perfect message. But sometimes we forget about the type of message that we have to give to the population. You know, what they will have as a big impact, what can really change their attitude. And for me, that is the key. You know, we always are putting messages like you have to eat more fruit, you have to eat more veggies, but we are seeing that it's not producing a behavioral change. So how can we think all together to say to the government which message to spread that actual produce a change of the population? I mean, for me, that is the key, but obviously all together working at once with with a common end.
I do believe that the health and lifestyles and well-being must be approached with an integrative system with academia and researchers, scientific knowledge, also with the institutions and organizations, and of course with the companies, and especially food companies. So it will be we must join together to fight all of the inequalities on health.
So if we can just have one wrapping up like sentence from all three of you in order to close this discussion in terms of nutritional recommendation in the context of COVID-19, what would this be? Let's start in the order of the talks that were given. So first of all, with Dr. Cacialanza.
My recommendation is really to try to see the problem and not to. It's an important focus. It's just. I really hope that institutions could focus on that. Food industries and the clinicians and scientific societies are already focused on that. I think it's very important that we make any effort to sensitize also the institutions and for patients and general population. It's the time to take care of yourself from a nutritional point of view, because it's fundamental also for the health in the future. Not just COVID-19 will pass. We will have the future in front of us, and if we want that it is healthy, we really have to consider nutrition an integral part of our everyday life.
Thank you very much. Professor Silva, could you go next?
Okay, I do believe that policies need to be evidence-based. So we must go further based on evidence, on real data and good methodological scientific research in order to build or rebuild the healthcare system more equal and more suitable for people.
Thank you. And we conclude with Dr. Laguna.
You. I very agree with Dr. Cacialanza and Dr. Silva that we have to look forward, but we are going to pass this. And meanwhile, don't forget about yourself. Keep, having this shopping that makes you feel better, that is healthier, usually makes you feel more good. It doesn't have any guiltiness behind. Keep trying to make a time in this time home work to take care of you, because we are going to be out and we need to be strong during this time and take care of ourselves.
Okay, so thank you very much to all three of you for your interventions. I think it was a very interesting session. We had quite a few questions that we could not answer due to time limitations, but we need to move forward. So we're going to close this session now. Thank you once more to all the three speakers. And now, before real lunchtime and during our innovation e-lunch, we will have the opportunity to get to know 5 innovation projects developed by EIT Food Partners. So what we will do now is be able to watch 5 videos prepared by 5 EIT Food Partners to present their projects. We'll be watching the 5 videos, and after each one of the videos, we will have a short time for questions. So please make sure that during the video, you send some questions so that we can discuss, so that you can get more answers and some more information about what's going on in the innovation field and what are the projects that are now being funded by EIT Food. Okay, so I'm going to read you first all 5 projects, and then I'll introduce the speaker who is responsible for the presentation, who will be watching for each one of them. So the projects are PERSFO, Personalized and Connected Food Service Providers, followed by SureBar, integrating innovative sugar and fiber technologies to produce clean label sugar-reduced products demonstrated through cereal bars. Then Food for Senior, high nutritional and sensory quality food innovations for the promotion of senior health. And then Oleogels, healthy and sustainable replacement for saturated fat and palm oil in spreads. And the last one will be Smart Food Logging. Smart Food Logging will develop a platform where health coaches and consumers come together to motivate users reaching their goal. So we will see all 5 of them, and we start with PERSFO, Personalized and Connected Food Service Provider, and we welcome Paul Fingles, Managing Director at Quadram.
Everybody, my name is Glenn Matthijssen. I am co-founder and co-CEO of Alberts, and today I'm a proud representative of the PERSFO consortium. PERSFO is about personalized and connected food service providers, and at this innovation forum I have 4 minutes, so let's go. The idea was born while drinking a coffee together with Laurent Cousin, the innovation director at Sodexo HQ, who on the one hand learned that influencing suppliers towards better quality is feasible. However, forcing consumers to choose the healthy option in an offering is almost impossible. And yes, apps can help us. However, it's usually only the healthy consumers that actually try them. Hence, PERSFO to convert consumers into more healthy consuming employees. So we have a very experienced team. At Alberts, we are working on food robotics applications. Sodexo doesn't need any intro, I guess. They serve 100 million consumers a day. Shift and the Quadram Institute and Eurofear have a strong background in personalized food with Food for Me project and the CRISPR project. And then the KU Leuven is helping us out with developing nudging algorithms and engines. So why food service? At food service, everybody's on the same page. The consumer wants to eat healthier, but too often fails. The employer wants a healthier workforce, and the food service provider wants to differentiate from competition and not be commoditized. So everybody wants a healthy offering, everybody wants people to eat healthy, and that's different from other sectors like retail, where often big brands disrupt the landscape. Why food service today? Health was always a core focus for a food service provider like Sodexo, but even more today in the corona crisis. People need to be moved towards empowered consumers who get personal offerings in a digital platform and work with food robotics and AI applications. Food service providers want to move from input, being remunerated for serving food, towards output service providers, being remunerated for having a happy and a healthy workforce. We're working with contextualized consumer information. In that data-rich and connected food system, we then want to develop real-time personal recommender systems to get people towards a healthier diet. We have did first low-fidelity designs. We were testing with different goal settings, different visualizations, different throttlings and streaks. And out of all of these options to nudge people in the framework of Sodexo came then data that we could analyze, and now we're working on the first consumer point of view. So this means first designs of an in-app engine, so not an extra engine, not an extra app that you take with the Sodexo app. You will be nudged because of the things you love. We know you love mango. You can fill out food frequency questionnaires, which still relate back through Food for Me and CRISPR. You can choose the level of coaching you like on how the app should coach you for healthy food. You're motivated by streaks, as we've studied this year already. That works very well. You will be matched with how much does this meal fit with you, just like in Netflix, but you will get also transparency why we believe it fits to you. Very important is also the client point of view. Not only see what are my consumers, what are my employees eating, but also launch campaigns. So here, a campaign is launched only on a sunny day. The campaign is launched when the consumer starts commuting and when you're near the facility. In this case, a smoothie will be automatically being prepared, so you can pick it up. In year one, we did low fidelity designs. We will still launch an on-site study in December. And then next year, the second year of the project is all about long-term intervention study in the field. So I hope you have an idea of what we're doing. We are very enthusiastic about the technology we're creating and the results we're getting. So any questions, shoot. Thank you.
Okay, thank you very much. Hope you've enjoyed this video. I think that I was advised by the technical team that it's better to watch all the 5 videos and then we can have all the questions. It might be easier for the streaming of the event. So if you agree, we can pass now to the second project is SureBar, integrating innovative sugar and fiber technologies to produce clean label sugar reduced products demonstrated through cereal bars. And the presentation will be given by Julia Rodriguez Garcia, lecturer in food science and technology at Reading University in the UK.
In this presentation, we are going to discuss some results from the SureBar project, integrating innovative sugar and fiber technologies to produce clean label sugar reduced products demonstrated through cereal bars. The consortium is formed by the University of Reading, Dumatok, Strauss, Beulah, and Herbstein and Fox. The objectives of the SureBar project are to reduce by 40% the sugar on the cereal bars while maintaining a similar texture, mouthfeel, and flavor, and to assess the technological and nutritional functionalities of the sugar fiber solution developed to increase and to expand the benefits on the cereal bars. 4 different formulations were developed. In all formulations, the binder was mixed and cooked up to 80-85 Brix degrees, and then mixed with cereals, then molded, and the cereal bars were cut. In the standard formulation, with 13% of sugar, the binder was composed by water, glucose syrup, sucrose, inulin, and dextrin. The second formulation, with 10% sugar, the binder contained no sucrose. This was replaced with Incredo sugar first generation, a sugar made with an inorganic carrier. The glucose syrup was decreased, and the content in water, inulin, and dextrin increased. In the third formulation, with 9% sugar, again the regular sucrose was replaced by the Incredo sugar first generation, and the glucose syrup was partially replaced by inulin, dextrin, water, and legria. A malted barley revalorized fiber. On a fourth formulation, the binder was composed by Incredo sugar first generation, and the glucose syrup was partially replaced by water, inulin, dextrin, and an apple pectin. In the formulations with legria and apple pectin, a 40% sugar reduction was achieved. The viscosity of the binders was evaluated at 90 degrees Celsius, simulating the cooking step. The standard binder and the one with inulin, dextrin, and Incredo sugar saw the lowest viscosity values, while when pectin was added into the binder, the viscosity significantly increased at lower sear rates. These results should be further investigated, as really high viscosity at lower sear rate could have implications in the processing line at industrial level. Figure 2 shows the evolution of hardness during 28 days of storage at 19 Celsius degrees. So the replacement of glucose syrup with water and fibers gave place to softer cereal bars, and all the cereal bars studied showed an increase in hardness over storage time. Figures 3 and 4 showed the sensory profile of the cereal bars. Cereal bars made with malted barley valorized fiber, legria, were more brown, more dense, with a malty flavor, less crumbly and sticky texture, while cereal bars made with apple pectin were slightly more sour and bitter, more chewy, and also less crumbly and with a sticky texture. Other formulations were closer to the standard. The main conclusions of this part of the project were that the use of apple pectin or Legria to partially replace the glucose syrup gave place to significant differences in the viscosity of the syrups and the sensory profile of the cereal bars. However, the use of inulin and dextrin gave place to samples that were closer to the standard in terms of the sensory profile.
So now we will watch the third video. This is about the project Food for Senior, high nutritional and sensory quality food innovations for the promotion of senior health. And the responsibles are Ainara Arregui, R&D program manager at Angulas Aguinaga, and Irene Peral, food researcher at ASTI. Let's watch the video.
Senior population is increasing, especially in Europe. Nowadays, 90% of the population is over 65, and in 2030, it will be 30%. The truth is that we want to live longer and with a better quality of life, but we have to face problems that occur with aging, such as cardiovascular diseases, difficulties for swallowing, and changes in nutritional needs. These problems have a high incidence in population. For example, 75% of senior population suffer cardiovascular diseases. Of course, these problems lead to heavy public health costs. In this context, with Food for Senior project, we want to create value-added, protein-based new products that will contribute to maintain a healthy aging. The market opportunity for this project is huge because, on the one hand, and as mentioned before, in Europe in 2030, 30% of the population will be over 65. And on the other hand, fish and meat are common proteins in our diet. In fact, the average European consumer spends 28% of their total food expenditure in fish and meat. And why is it important now? I would say two main reasons. Firstly, there is a lack of food products targeted at senior population. In retail channel, less than 1% of the food launched is targeted at seniors. And secondly, there is an increasing knowledge of the importance of a healthy diet to maintain a healthy aging and better quality of life.
In Food for Senior project, we aim to develop senior-oriented food products. Innovative value-added fish and meat products ranges for European senior consumers. We say food products because we want to emphasize the importance of never losing the pleasure of eating. Products that are convenient, easy to prepare, easy to cook, easy to swallow. Products that are co-created with seniors, taking into account their needs and expectations. And finally, products that have enhanced and adapted nutritional and sensory properties. Also products with functional ingredients that help to reduce the prevalence of aging diseases. Fish and meat products high in protein, omega-3 fiber, and macronutrients. A range of new products that we allow to include these products in long-lasting, healthy, and sustainable menus. Specifically, in the project, 2 new products oriented to seniors will be launched in 2020. 1 fish protein-based and 1 meat-based. In a first step, we want to cover Spain, France, Italy, and UK in both retail and food service channels. It is important to highlight that the positive outcome of this project will have a big impact on society, more specifically on public health, increasing well-being and reducing health costs. We will plan to achieve all this with a well-balanced team, research centers with expertise in consumer behavior, and companies with strong and commercialization capabilities. The team is composed of Angulas Aguinaga and ABP Food, specialists in fish and meat protein-based products, Hershey and Fox, specialists in fibers and pectines, and ASTI and Angulas Research Center, experts in food development and consumer research. Angulas Aguinaga is a seafood processing company leading the market with innovation and branding. ABP is a specialist in red meat-based products in Europe with manufacturing capabilities in fresh and frozen meat products. Hansen and Fox, with a long history of experience in the production of high-quality pectin products and fibers for the most diversified food applications. ASTI, specialist in new food products development, including consumer sensory research, food processing technologies, and technology transfer to the food industry. And Gula Saginaga Research Center, a specialist in food process technologies and consumer and market science. And last but not least, we believe that one of our key success factors is consumer involvement. To increase product acceptance, we are going to develop the new products in co-creation with senior consumers.
We will proceed now with the fourth video on oleogels, healthy and sustainable replacement for saturated fat and palm oil in spreads. It will be presented by Christian Zackerl, Food Business Manager at Fraunhofer.
Hello everyone, I'm Christian from and today I'll show you a short pitch on our oleogels project. Oleogels, healthy and sustainable replacement for saturated fat and palm oil in spreads. So what was the project about? In this project, we developed a tailored fat-based ingredient based on oleogels and incorporated this into new and consumer co-created spread products. And this product showed really good textural, sensorial and functional properties comparable to the benchmark product with full fat content. These products showed really good advantages in terms of nutritional aspects. So we reduced the fat content by at least 30% and maintained the sensorial and functional properties. Additionally, we could work completely without the addition of palm fat and used regional oilseed origins. So who was the project consortium about? So we were 4 partners, where Fraunhofer IVV was the coordinator and responsible for the product development. University Warsaw was dedicated to the consumer studies and the co-creation of the products. And the 2 industrial partners, Assessur and Maspex, developed the base fat compounds and the spreads, and did also the scale-up and production in industrial scale. So what were the challenges in fat reduction in general? Actually, the saturated fatty acids are mostly responsible for the positive textural effects in those spreads, like the good texture or the mouthfeel during this consumption. However, they also are responsible for the bad health effects, like cardiovascular diseases and others. So the big challenge was to reduce those saturated fatty acids with liquid oils by maintaining the structural properties. And this could be realized by oleogels. Oleogel is defined as a liquid oil which is structured by a gelator into a solid structure. So the product should be thermovisible and have properties similar to solid fat. And how this worked, I will show you right now.
Hi again. Now we're in the chocolate pilot plant from Fraunhofer IVV. Here we can produce chocolate and start from the cocoa fruit over the cocoa beans and do all the working steps towards the chocolate or even spread products. So for producing the oleogels, we take a plant-based oil and some oleogelators and mix those ingredients in a specific device, having defined shear rates, defined heating and cooling rates, and end up after cooling with an oleogel product. So you can see that the structure has significantly changed from liquid to a semi-solid structure, which is quite similar to palm fat.
And as you can see here now, we had success in reducing the saturated fat content from 22% in the standard spread to 12% in the oleogel spread, which is a reduction degree of 42%. So now the major question, how does it taste?
But now I would like to taste it. Delicious. But wait, there's one more thing. These spreads are not only spreadable at room temperature, but also directly from the fridge.
Thank you very much. Keep sending your questions. We will address all of them at the end of the session of the videos. Now we will proceed to the last one. There's been a change to the list that I read you at the beginning. Now we will be talking about, you'll have to excuse me because I'm not sure how to pronounce the M-Teaching COVID and Health Triggers project. I think we will have more cues on how to interpret this after we watch the video. It's about connecting recovering COVID-19 patients with dietitians and health coaches for a quicker recovery, and food coach to boost immunity level to reduce the chance to get COVID-19. Let's watch the video.
Hi there, my name is Sandrine. I am the project manager responsible for 2 EIT COVID projects, which I'm going to pitch to you in less than 4 minutes. The first one, the Matching COVID project, targets at recovering COVID patients, recovering whether it's light, recovering at home from some symptoms to very severe, being hospitalized and getting back at home. We want to help you get in touch with a dietitian, a health coach, to get you back on track. You know, you have sometimes a loss of smell, a loss of taste, your immunity system is going down. You don't feel like actually eating good food, and it's very important that you eat right food to get back in a healthy shape. So therefore, we collaborate together with dietitians and health coaches. We collaborate together with Aarhus University, who is doing a qualitative and quantitative study with COVID revalidating people. And it's actually very I'm going to present you a bit of a prototype later on, and actually it's getting it will be a very nice solution that we will put in the market by the end of the year. The second project, Healthricious, aims at getting more intelligence into our food coach application. With intelligence, I mean getting more health concepts like immunity framework in our application. Therefore, we work together, we collaborate through this project together with eMake One Planet as a science partner. Basically, it means that we also can tag content, products, but also recipes that can help you with getting back a better immunity system, which is very interesting. We have 2 target groups here who are very, very important for COVID, which are the obese elder men, and also people with anxiety who have more food cravings. And due to those food cravings, they result in weight gain. And then the weight gain results in more affections of COVID-19 or a less immunity system. So actually, those 2 projects are more and more merging together. Which is very interesting. The Healthricious application really has the full customer journey, from inspiration of recipes based on your preferences, recipes, products, tips and tricks, inspiration, to also a planning mode and a shopping mode, so that you can actually also change your behavior via the application. Of course, there's still a roadmap ahead. We're not going to be able to put all the features now in the market in the end of December, but we're really heading towards an application that can also support the behavioral change. I'm going to show you some more concrete Figmas. I still have a few seconds for that. This is a view on the coach that we can match with you if you're a user using the application. The coach can also make your appointment with you via the app, so you really see the 2 sides of the platform coming together, the value for both parties. The coach can make your appointment. The coach can also make a meal plan for you. Maybe I can show you that here. This is actually an onboarding for the coach, where he gets his patients suggested via the application. He can start coaching his patients via a management module that he has access to. He can create appointments. He sees the profile of the user, which is very interesting, because if he sees the profile, he can also have this information in his advice, in his digital consult that he has with the user. During his consult, he can add some focus points, some concrete actions that the user will retrieve back in his application. So there's a follow-up possible via the application as well. And he can also create a custom meal plan, adding recipes from our recipe management, or he can add his own recipes via URL. This is a bit the view I wanted to show you for the coach. I also have a view to present to you for the onboarding and the health-ricious content. He will see, for example, that we're going further than just COVID-19. Also people with like diabetes and so on, they can be also matched with the coach. I actually see that I'm already at 5 minutes, so maybe more questions can always be sent to sandrine.vanderlinden@smartwithfood.com. I'm happy to get them answered, and I'm very happy for this short introduction. Have a good day. See you soon. Bye.
Hello again. I hope you have enjoyed these 5 videos. So now, in order to be able to ask any questions to the promoters of this innovation project, we have with us a Glenn Matheson from alberts.pe, a Julia Rodriguez Garcia from the University of Reading, Ainara Arregui from Angulas Aguinaga, Irene Peral from ASTI, Christian Zackerl from Fraunhofer, and Sandrine van der Linden from Smart with Food. So if you allow me, I will ask a first question, and then I think we will activate the microphone so that you can directly ask your questions to the people behind this project. So if I'm allowed to ask, welcome everyone, and thank you for these interesting presentations that you've shared with us. Can you share with the participants of today's meeting what has been your major challenge during these times, the COVID times, in order to carry on with your innovation or to communicate the outcomes and the results that you're getting with the use of your technologies? What has been mostly hindered? And if you want to give a more positive point, what have you noticed that is working particularly well in this complicated context?
Hello, my name is Glenn Matheson from Albert, the representative here today of the Perso project, the first video. I think, yeah, particularly challenging with the COVID-19 crisis is, since we work with a food service partner, Sodexo, it's really a big challenge to go to the market, because food service, of course, is directly hit, being the fact that people at work are usually now at home. But what was, I think, on the more positive side, because I have to admit I'm more of a positive person. So on the positive side, when we then had a meeting with Laurent Cousin, the director of innovation of Sodexo, he really mentioned to us that the work that we're doing is actually more important, let's say, than ever before. Because right now it's even more important to become more of a health partner than pure of a food service provider. So I think that was a cool twist. That was around September. Actually, we felt, okay, it makes way more sense what we're doing. And we were then on the positive side, we were then also able to secure a location for December to do a test. So even now, something is still possible.
Good to know, to finish on a positive note. So who wants to go first? Next, sorry.
I might go in, just briefly.
Of course. Christian, we can hear you.
Actually, the original project was performed in 2019, so we were lucky to be early, finish just the development. However, the implementation and the transfer towards the market, which should be happening this year, was a little bit hindered by the COVID restrictions. So we hope that it will be coming next year to market, but we were quite quick before the COVID crisis finished, so we had no limitations there, but the implementation now is a little bit hindered.
Let's hear another opinion now.
Hello, good afternoon. I'm Julia Rodriguez Garcia. I'm JPI of the Surebar project. I think for us, the major challenge during this year project has been the access to the facilities, as the university was closed. So the idea was that we will be doing some fundamental studies of the ingredients and the formulation to inform the commercial partners on how to proceed with the reformulation. and that was a bit delayed for the project. So this year we just plan to be working until the last minutes of the project. And another big challenge for us is how do we restructure the work with the sensory panel, with all the restrictions, with the social distance, and so on. But we have an amazing team in the department, and they have sorted out these things with all the safety issues around. So yeah, we are just proceeding as normal with the project now. I'm glad.
That's good to hear. Let's continue. I don't know if Ainara, Irene,
yeah.
yes, and
hello.
You want to
hello.
share your views?
Hello.
Hello.
Yes, this is Ainara from Angola Saginaga, and I would say, as Julia has said, that adapting the work plan has been a challenge because there have been some months that for example, the research centers couldn't go to their facilities. Industrial partners, as we are food industry, we could work, but it has not been easy as well. So we have to adapt our work plan. And I would say another big challenge has been, or is being now, the introduction to the market, because in retail channel, the retailers are this year very, very busy with their situation, and it's difficult. It's been difficult, the introduction of new products. So in some cases they are delaying some launches for next year because, for example, in Spain, due to the COVID situation, people are being at home and they spend more time cooking, so they maybe another products different than the ones that they think. So the situation is being, the launching to the market is being complicated.
Yes, Ainara?
Yeah.
So yes, can you see me? Yes.
Yes, yes, yes.
I wanted to add also that we have had some difficulties in engaging consumers at the beginning of the project, because we developed focus groups with senior consumers. But just when we finished our work, the COVID alert started and all people were confined. So we have managed to deliver this, to continue with this study with consumers. But of course, this is very difficult in the current situation because you cannot invite people to come to our center and discuss about the new product development. So we have had to adapt the project, and also, as Ainara said, the technical work in the facilities at ASTI has been difficult because we have limitations of aforo, of people working at the same time, and also problems with ingredients and raw materials delivery due to the close of frontiers, the barriers for traveling and all this. Yes, but I think that we have managed to continue with the work. We have done a big effort these last months, and we hope to success in the project. Yes.
Let's hope so. Okay, and let's close with Sandrine. I don't know if we have her connected right now.
Yeah, do you hear me?
Yes, we can hear you and see you.
I can contribute to that. We also see that it's more time now to move from food to health. People really put it more on the agenda. For my project, for example, we offer an online platform for health coaches. And you see, we just launched, we're using social media channels now as well more and more, because it's difficult to reach them in person due to COVID. And if you launch like a Facebook advertisement to see whether they want to help with the beta testing of the platform, they're very eager to contribute, because they're searching for new business models, and they see that less people are entering physically their practice. So they would love to have to contribute to a digital tool. It's a bit what we see everywhere now. So I think the situation.
Vamos a abrir el micrófono.
It's really it's difficult, but people are eager to help with innovations, and that's really nice. Yeah. So that was my feedback.
Okay, thank you. So I don't know if members of the audience want to make any direct questions to related to this project. I think we can activate the mics now. So if anyone can ask a question, you can raise your hand. In order to do so, you have to go to the line of tools that you have at the bottom of your screen. You have to select the option participants and then the option raise your hand. We will see a little hand raising on the screen, and then you can ask directly your question. So I think it is a good opportunity for all of you to ask any questions. Nothing yet. I'm strongly motivating you to ask questions. I think it is a rare chance when you can have together in the same virtual room 5 people working in 5 of the most innovative projects that have to do with nutrition in Europe right now.
On the thermoreversible spread, I was wondering if when you incorporated that new oleogel into the cocoa powder and so on, if you perform any thermal treatment on the spread or it was just directly into cooling?
So I guess we can conclude this session. I think it was very interesting to have this presentation about this innovation project. I think we got to learn quite a lot today, and now we can proceed to our lunch break. It is now 1:45 Central European time. So we will be joining you again in half an hour exactly at 1:15. So enjoy your lunch break and see you soon for a very interesting afternoon session. We have roundtable discussion, we have our keynote speaker session. So please make sure you come back on time at 1:15. Thank you and see you soon. Okay, I think that now we have most of the people back. We will start this afternoon session with our discussion session on the future of targeted nutrition. And in this afternoon session, we will have the opportunity to hear about most of them. So for this very interesting session, we have the pleasure to bring you here today 3 experts who will give us their views on different aspects of targeted nutrition. We will start with Dr. Ignacio Hernández Medrano, consultant neurologist with training in healthcare management and experience in clinical research strategies, who will talk about artificial intelligence, fact from fiction. And then we will continue with Dr. Luca Coccolin, professor at the University of Torino, editor-in-chief international of food microbiology and president of the Italian Society of Agriculture, Food and Environmental Microbiology. He will be talking to us today about
Nos va a hablar sobre microbiota y
conclude with Professor Ascensión Marcos from the Institute of Food Science, Technology and Nutrition from the Spanish National Research Council, who will shed some light on the concepts of immunology and immunonutrition. So we can start with the first talk. Make sure you send your questions during the talk and we will discuss with the speakers and all of you a little bit later. Enjoy the session.
Muchas gracias por invitarme. Encantado de poder participar con vosotros. Mirad, voy a hablar de tú. Hay varias maneras de intentar explicar lo que es la inteligencia artificial o lo que está pasando con ella. Son sistemas no basados en reglas, sino basados en aprendizaje por patrones, ¿no? Y eso es básicamente lo que está cambiando en el mundo. Hasta hace muy poco los ordenadores, las máquinas que teníamos, solo les podíamos enseñar por reglas. Eso es muy ineficiente porque cuando aparece un nuevo caso no pueden hacer nada con él. Pero desde que en 2012-2013 empezamos a hacer extensivo esto del aprendizaje automático, en inglés Machine Learning, y luego tiene muchos apellidos, ¿no? Deep Learning, Neural Networks, da igual. Al final, inteligencia artificial, el nombre es muy marketingiano, no lo es, da igual. El concepto es lo importante. Y es que ahora tenemos máquinas que pueden aprender a base de ver patrones y eso nos lleva a una nueva dimensión. Esta en la que, dicho de una manera muy resumida, si tú le das un set de problemas resueltos, por sí mismo, ahí viene la clave, es capaz el programa de inferir las reglas y cuando viene un problema nuevo que nunca ha visto, es capaz de resolverlo correctamente, ¿no? Y esto es lo que es diferente y lo que nos está poniendo en una nueva dimensión del uso de las máquinas para aproximar problemas de conocimiento, ¿no? Hay tantos ejemplos a día de hoy en la prensa, en todas partes, sobre cómo la inteligencia artificial está moldeando las industrias que no acabaríamos nunca, pero por citar uno o dos rápidos, pues Amazon sería un buen caso, ¿no? No eran el Corte Inglés, ¿no? No eran Walmart, no eran los mejores en saber quién y cómo iba a comprar alguien algo, ¿no? no eran los más expertos en ese campo, pero tienen suficientes datos como para empezar a construir machine learning, algoritmos de este tipo, que anticipan la demanda, la oferta, la infraestructura y se convierten en la empresa número 1 del mundo. Y esto lo hacen en gran medida gracias a la utilización de este tipo de algoritmos de aprendizaje automático, ¿no? Y otro buen caso pues, sería el de Netflix, ¿no? No eran la Columbia, ni la Universal, ni la Warner, no eran los mejores en hacer películas. Pero como tienen muchos datos de quién y cómo y cuándo, son capaces de inferir quién va a querer un capítulo de algo en un momento determinado y se convierten en la primera empresa de producción de cine del mundo en muy poco tiempo, ¿no? Y lo mismo ha ocurrido pues, desde la política a la policía, a diferentes industrias en las que no tenemos tiempo de detenernos. Siempre con esa idea, y esta es la clave, de que estas máquinas, en definitiva, lo que hacen es ver correlaciones donde la mente humana no las ve. Y gracias a esta capacidad son capaces de dar respuestas correctas, incluso aunque no sean expertas en la materia en la que están funcionando, ¿no? Siempre es el mismo elemento. Entonces, cuando esto nos lo llevamos un poquito más cerca de la nutrición, como sería a la sanidad, a la medicina, que es donde yo me desempeño, yo soy neurólogo, encontramos que tenemos ejemplos también, ¿no? Como Google DeepMind, en el Reino Unido, en 2016, publicó este artículo en el que decían, mira, yo mirando al fondo de ojo, mirando a la retina de las personas, soy capaz, porque he visto muchas fotos, de decirte quién tiene una retinopatía diabética mejor que el conjunto de neurólogos o de oftalmólogos. Y esto lo llevan a tal extremo que acaba siendo aprobado por la FDA, ¿no? Por la Agencia de Evaluación de Tecnología Americana. Y ellos continúan trabajando y en el segundo semestre del 2018 dicen, mira, pero aunque ningún médico jamás sería capaz de mirar a esas arterias que hay ahí en esa retina, esos vasos retinianos, y decir si eso es un hombre o una mujer, como yo veo correlaciones donde la mente humana no las ve, te digo que acierto el 97% de las veces quién es hombre y quién es mujer, lo cual pues es muy sorprendente, ¿no? Dices, bueno, pero eso clínicamente no tiene mucha importancia. Entonces, sí, pero es que ahora voy a hacer lo mismo con el riesgo cardiovascular. Fijaos en lo que estoy diciendo y por qué esto tiene que ver con la nutrición. Porque, en definitiva, una máquina, y esto lo publican en Nature, no estamos hablando de algo, digamos, mal hecho o dudoso, es capaz de predecir el riesgo cardiovascular de alguien mirando al fondo de ojo, que es algo que ningún ser humano podría hacer. Claro, y a partir de ahí te das cuenta de que las implicaciones de esto potencialmente no tienen límite, porque ¿cuántas cosas todo con todo van a ser estas máquinas capaces de correlacionar? ¿Cuántos nuevos biomarcadores? ¿Cuántas nuevas formas de enfrentar el conocimiento donde nosotros no podríamos ni llegar? Entonces, la extrapolación a cualquier área es muy inmediata, ¿no? Es muy evidente. De hecho, la FDA americana, desde 2018, ha aprobado hasta la fecha 37 casos de inteligencia artificial porque hayan superado el umbral humano sanitario, médico, en diferentes áreas, en diagnóstico, en tratamiento, en pronóstico, siendo probablemente el máximo exponente la imagen. De hecho, para el Lancet, el gran avance de 2019 fue el que las máquinas alcanzaban a los humanos en diagnóstico por imagen. Por eso, si esto ha ocurrido a través de diferentes áreas patológicas, no hay ninguna razón para pensar que la obesidad o cualquier otro campo en el que nos desempeñemos vaya a ser una excepción. De hecho, no paramos de recibir artículos prácticamente ya todas las semanas de alto impacto, artículos buenos, en los cuales un sistema de machine learning supera el estado del arte en predecir quién va a responder a una quimioterapia, quién va a responder a un antibiótico, quién va a responder a un test de laboratorio. Y todo ello no solamente ya con capa de imagen, sino con otro tipo de datos, como pueden ser datos analíticos, datos de UBI, etcétera, etcétera, y como digo, a través de las diferentes áreas patológicas y terapéuticas. Con lo cual, siendo tan nuevo, pero a la vez tan rápido, hay que pensar que esto de manera inmediata es aplicable al campo que se está tratando hoy. De hecho, sin yo ser un experto, respondiendo a la amable invitación de tenerme aquí, hice una búsqueda rápida en PubMed buscando si había Machine Learning y obesidad o Machine Learning y nutrición, y por supuesto que la había, lo cual nos sorprende porque en realidad ya en todos los campos de 3-4 años para acá y sobre todo los últimos 2 empezamos a tener abundante literatura que nos empieza a enseñar el camino de cómo utilizar a estas máquinas para llegar donde nosotros no llegamos, ¿no? ¿Y esto cómo se materializa, cómo se operativiza? Pues al final lo que necesitas básicamente es una pregunta de investigación, esto es lo que yo quiero saber. Necesitas una persona que te construya ese algoritmo, que se llaman data scientists, ¿no? Científicos de datos, la persona que te arregla las tuberías se llama fontanero, la persona que te hace un algoritmo de deep learning se llama data scientist, es a ellos a quienes hay que acudir. Y luego necesitas darle datos, ¿no? Darle capas de datos para que pueda alimentar ese sistema que aprende por sí mismo. Las capas de datos en sanidad, en obesidad, son múltiples, están ubicuas en muchos sitios. Pero si tuviéramos que centrar algunas, sin duda una primera capa de datos serían los sensores. Sensores hay en los relojes, hay en las camisetas, hay en los móviles, sensores hay por muchos sitios y son interesantes porque nos dan mucha información y cada vez nos van a ir dando más. Crece exponencialmente el número de sensores que los ciudadanos van utilizando y algunos ya con aprobaciones por la FDA, infección de orina, hipertensión arterial, fibrilación auricular. Por tanto, no hay ninguna razón para pensar que esto sea diferente en el campo que nos toca hoy. Una siguiente capa de datos muy interesante sería, y necesaria, traerla en la genómica. No hace falta ser un visionario para entender que si el genoma está en pocos cientos de euros y tenemos países como Singapur, Corea o la propia Inglaterra, donde tenemos ya cientos de miles de ciudadanos secuenciados, Genomics England, no hace falta, digamos, irse muy lejos para entender que esto llega, esta secuenciación a los ciudadanos y que es una capa de datos más con la que al final alimentar ese machine learning, ¿no? De hecho, JAMA y New England ya lo dijeron en la primavera pasada. Sí, lo hemos entendido. Estos machine learning también se alimentarán de las variantes genómicas y como hay que darle un nombre, le vamos a dar el nombre de Polygenic Risk Score. Entonces, la aplicación inmediata a la nutrigenómica, digamos que es muy evidente, ¿no? Es como el siguiente paso. A pesar de que no sepamos bien lo que ponen esas variantes genómicas, a su vez utilizamos el deep learning para entender esas relaciones fenotipo-genotipo, esa interacción gen-gen, qué significan esos polimorfismos, ¿no? Esto va más rápido de lo que el experto, de lo que con nuestra mente, ¿no? De una regresión, una estadística clásica, pensaríamos, ¿no? Lo que haríamos con nuestro SPSS. No va de eso, va de encontrar vectores, correlaciones, también en esas interacciones donde nosotros no llegamos. Y si tuviera que citar una tercera capa, y podríamos citar más, microbiómica, proteómica, alimentando ese machine learning multiparamétrico, multicapa, sería probablemente aquel al que yo me dedico, ¿no? Y que me dedico porque pienso que es relevante y es el texto de lo que se anota, ¿no? Lo que se anota en una web, lo que se anota en una historia clínica. Es decir, no solamente tiene por qué ser un dato estructurado, puede ser un dato desestructurado porque a día de hoy tenemos tecnología que se llama procesamiento del lenguaje natural, Natural Language Processing, que es capaz de transformar el texto en variables, de tal manera que síntomas, signos, efectos adversos, informes de un especialista, pueden ser también, pueden nutrir, valga la redundancia, esos machine learning. No solamente tiene por qué ser imagen o genómica o datos analíticos, también podemos hacerlo desde el texto. De tal manera que eso nos lleva a montar modelos predictivos clínicos utilizando esa extracción o esa conversión del texto humano hacia la máquina, porque es una tecnología que se ha desarrollado suficientemente en los últimos años y es esencialmente a la que yo me dedico, ¿no? Por supuesto que habrá limitaciones en el camino. Ya Gary Collins hace un año y pico las describió. Dijo, sí, muchos de estos algoritmos predictivos basados en machine learning que nos van a llegar en medicina, en sanidad, van a tener limitaciones, problemas de aplicabilidad, sesgos, y la respuesta a eso es, por supuesto, como en toda la literatura científica, llegará una gran mayoría de mala calidad y una pequeña minoría de gran calidad que será la que entre en las guías clínicas y será la que tengamos que considerar. Y probablemente el único camino es hacer ensayos clínicos, probar en hospital sin inteligencia artificial, hospital con inteligencia artificial, medir a los 3 años y ver quién ha mejorado. De esto tenemos ya en marcha unos 5 o 6 ensayos, los primeros que vienen todos desde China, y enseguida empezaremos a ver resultados y aplicación a guía clínica. Y, por supuesto, siempre tendremos que tener en cuenta la ética. En este sentido, es bonito el caso de JAMA, el editor de JAMA, que poco antes de la pandemia en China analiza este artículo en el que, a través de la foto de la cara de estos ciudadanos, somos capaces de sacar quién tiene fibrilación auricular, quién tiene una arritmia, cual es muy sorprendente desde el punto de vista de un clínico, pero él dice algo más, dice cuidado porque hoy son fotos y arritmia, pero mañana puede ser fotos y psicosis, los problemas están ahí. Al final, lo que yo he aprendido en estos años, dedicándome íntegramente a llevar la inteligencia artificial al sector sanitario a través de Sabana, es lo que intento representar con esta foto de Picasso que tan visionariamente lo entendió, ¿no? Ya en blanco y negro nos decía, todo esto está muy bien, pero es solo una herramienta, es solo una tecnología. Nosotros tendremos que hacer las preguntas correctas porque como bien nos anticipaba Pablo Picasso, los ordenadores son inútiles, ya que solo dan respuestas. Así que con las 110 personas, entre médicos, lingüistas, matemáticos, programadores, que trabajan todos los días en Sabana, para aportar un granito de arena a la humanidad en cuanto a la inteligencia artificial para predecir las alteraciones de la salud, pues es con esa foto es con la que os dejo, dando las gracias por la atención. Muchas gracias.
Thank you very much for this very interesting talk. I think that we can now proceed to the next speaker. In this case, it would be Dr. Luca Coccolin from the University of Torino. He will be talking to us about microbiota and targeted nutrition.
This course focuses on the human microbiome, with a focus on the gut microbiome. That is, all the microbes that live between our stomach and colon, and how they interact with our health. In the first week, you will be introduced to this fascinating world of the human microbiome and how it interacts and impacts our health and well-being. In week 2, you will learn about the journey of food, how our body absorbs nutrients, and how our microbiota is influenced by our diet. And in week 3, we'll explain how your gut microbiota and cells communicate, and why it's so important to feed your gut microbiota appropriately as a means to care for your health. By the end of this course, you'll have a good understanding of the human microbiome, our gut microbiota, and how our diet impacts and can benefit our health and well-being.
Thank you for the video. Probably you may wonder why I wanted to start my contribution to this discussion with this video. This is actually a course that we have been developing within the EIT Food on the human microbiome, and I really believe that is correctly picturing exactly what I would like to transmit during my contribution. You may also wonder why a food microbiologist is actually going to talk to you today about microbiota and targeted nutrition. My group has been involved for 20-25 years in the study of the biodiversity of microbes in fermented foods. And when we reached a level of understanding on what microorganisms could do in food and how they can be exploited in order to produce foods that are safe and that they are of high quality, my question was how these foods that contain a large number of the microorganisms can actually affect our health, because for sure those foods, at the moment we are introducing them in our body, they interact with the human microbiota and the gut microbiota, and for sure they will affect the way we are feeling and our health. So by this point of view, this is why I'm here. It has been now more than 10 years that we have been investigating the relationship between diet and health modulated by the gut microbiota and more in general, the human microbiota. I just want to open a little parenthesis here because when we are talking about fermented foods and human health, there is a very strong interest nowadays towards the benefit that those fermented foods can have on our health. I just want to underline that we should be very careful in avoiding confusions and not consider fermented foods, and especially fermented foods of plant origin, as probiotics. This is absolutely something wrong, and we should not fall into this mistake. Probiotics are something that are very specifically are regulated by law and most of the times have nothing to do with fermented foods. Fermented foods are foods that contain usually a high number of microorganisms that are beneficial, but again, they cannot be considered probiotics. This is something that I wanted to say because, again, there is a little bit of confusion, and at the moment we are talking about microbiota and how we can affect our microbiota and how this is actually correlated with our health. We need to be very careful in understanding the information that is out there and also be able to interpret correctly what it is transmitted and what it is distributed. Well, what can we say about microbiota and targeted nutrition? Let me start from the point that foods are an important source of components that are not only essential for us as human beings to be able to survive, but they are also an important source of nutrients for the microorganisms that are inside of our gut, and as in the case of the fermented foods, are important contributors for the gut microbiota. We need to be careful also about the differentiation about microbiota and microbiome, because are two terms that usually are actually, interchangeable. However, this is again not correct. We should talk about microbiota when we are dealing with microorganisms, and so by the ecological point of view, we have to speak about microbiome when we also consider all the activities that the microbiota can perform in terms of molecules produced, in terms of activities produced, and in terms of also capabilities to digest. It is already more than 10 years that has been clearly demonstrated how foods can affect our gut microbiota and microbiome. There are very interesting studies that have been performed on Western diet, on Mediterranean diet, on more rural or agricultural diets. Let's say that what makes it different, those types of diets, is one that is usually rich in fats, rich in animal proteins and carbohydrates. The other one, like the Mediterranean diet, for instance, is more rich in fibers, is more rich in vegetables. And when the studies have been carried out and compared, it is clear how the diets are actually modulating our gut microbiome by preferring or by pushing the development of some populations against other populations. And when some populations like Prevotella or Ruminococcus are actually enhanced in their growth because we feed them with components that are found in our foods that are important to support their growth, we also have benefits by the point of view of our health, because there are important molecules that are produced, like short-chain fatty acids, that have an extremely important roles in a number of activities that are characterizing our body. Just for you, to let you know, for instance, the development of the enterocytes at the level of the intestine. And if we consider that the intestine is the site inside of the human body where you have the highest response by the immunological point of view, you can understand how important it is to have this relationship correct. Let's also take into consideration that while at the beginning of those studies, we focused very much on the local impact that microbiota and microbiome could have on the intestine. Nowadays, we have been exploring a lot of other interactions, a lot of other communications. And so the benefits that are coming from the interaction or the activity of the gut microbiome, they can reach also very far sites from the intestine. It is one of the best known axes is the gut-brain axis. We have also now gut-liver axis, but also gut-kidney axis. So there is a lot that our microbiota and our microbiome can do by the health point of view. What is going to be the next step, or what do we need though in order to really exploit the microbiome in targeted nutrition? First of all, we need to understand more what microorganisms are doing inside of our intestine, but also I would say inside of our body. There are a lot of studies that have been carried out. I would say that there are just a few that can really be considered mechanistics, in a sense that they have explained the mechanism behind the interaction. A lot of them are observational, so they just observe some of the evidences. So we need to move also as scientists to more in-depth studies in a way that we can really understand how our microbiome can be modulated by specific compounds. The next step, at the moment we know how those things are regulated, is really go into the application of the knowledge that we have acquired. So at that point, foods and diet can really be targeted, can be really customized to specific layers of the consumer, specific layers of the citizens, in order to meet their needs in terms of foods, to modulate their microbiota and microbiome, and at this point really become preventive measures towards diseases. In this little contribution, in this little talk, I never talked about diseases because, again, I'm a food microbiologist. I'm not a medical doctor, so my contribution comes from the knowledge that we acquired working on healthy subjects. But it is for sure that microbiota and microbiome has a large effect on the development of diseases that not only are related to metabolic diseases, but they are also mental diseases and they are cardiovascular diseases. So the human microbiome is actually a field that is extremely exciting, very complicated, but it is something that we need really to investigate more in order to be able to get information that will be useful in the future in order to address those important issues that, you know, are actually one of the social challenges that we are facing at the moment. Thank you very much.
Thank you. There was a problem. I think that the organizers had silenced everyone so that there were no interruptions and I couldn't interfere. So thank you for your patience and thank you very much for your talk. I think that now we will proceed with Professor Ascensión Marcos from the Institute of Food Science, Technology and Nutrition. And she will be talking to us about immunology and immunonutrition.
Me dijeron que hablara de inmunonutrición y COVID-19. Entonces, bueno, voy a empezar hablando de lo que ha supuesto la venida de este virus. Bueno, hemos estado confinados durante un tiempo, ahora vuelve una segunda oleada. Esto no deja de llevarnos hacia una situación de estrés, con problemas a nivel neuronal, sobre todo con alteraciones de la gestión emocional, el estado anímico, incluso de la personalidad, problemas en el sueño, cambios alimentarios, de actividad física, y todo ello finalmente lleva consigo una alteración del sistema inmunitario que está interaccionando con cambios en la microbiota intestinal. Todo esto es lo que podemos denominar una alteración psiconeuroinmunológica y de estilo de vida. Aquí no deja de haber un fallo multiorgánico. Nos han hablado que había un problema importante en el sistema respiratorio, pero también sabemos que a nivel cardiovascular se están viendo fallos, también el sistema urinario, sistema locomotor, en músculos, huesos. Muchos pacientes que salen del hospital están teniendo graves problemas también. Sistema digestivo, por supuesto, sobre todo a nivel de hígado y, por supuesto, de intestino, la piel. Hay problemas a nivel cutáneo y, desde luego, ese eje entre el intestino y el cerebro que está ahí interaccionando y al mismo tiempo está afectando las alteraciones de uno a otro. Claro, el problema de quién tiene más riesgo de tener esta patología, bueno, pues depende de la edad y del sexo. Se ha visto que a mayor edad hay mayor riesgo y sobre todo el pronóstico es peor y peor en hombres que en mujeres. Por otro lado, la obesidad, no podemos dejar de hablar de ello, ni mucho menos. Hay un mayor riesgo en aquellas personas que están obesas. No hace mucho tiempo en España, en abril, nos encontramos con una mujer de 28 años excesivamente obesa que salía del hospital cuando, bueno, pues en un principio, en aquella etapa, los jóvenes no estaban tan afectados por la infección. Hay una serie de procesos inflamatorios que están asociados a la obesidad y son todas las patologías no transmisibles que podemos ver hoy en día. Y sobre todo hay más prevalencia de infecciones y de alergias. Pero no podemos olvidar que la obesidad se ha definido como un proceso de envejecimiento. ¿Y qué es lo que pasa? Que hay un proceso de inmunosenescencia. A medida que tenemos más edad, la respuesta inmune es más baja, la susceptibilidad a las infecciones mayor, así como la gravedad de estas, la eficacia de vacunas más baja y la incidencia de tumoración es mucho más alta. Con lo cual, la prevalencia de morbilidad y mortalidad en gente mayor es mucho más alta y no podemos olvidar este proceso de inflammaging, porque no deja de ser una inflamación crónica de bajo grado. Por supuesto, factores como la obesidad y otras infecciones, agentes contaminantes, estilos de vida no saludables van a estar involucrados. Es importante tener en cuenta un periodo prenatal y un periodo postnatal. En el periodo prenatal, por supuesto, estamos viendo que depende de la situación nutricional de la madre, si tiene medicación, cuál es su estado de salud. Y en la parte postnatal tenemos que decir que depende incluso del tamaño de la familia donde nace el niño, si tiene animales de compañía, dónde vive, si vive en una zona rural o una zona urbana y cuáles son las primeras prácticas de alimentación, si ha habido lactancia materna o lactancia artificial y cómo ha sido el parto, si ha sido vaginal o por cesárea. Todo esto conforma los 2 primeros años de vida que van a dar lugar a que el sistema inmune del neonato y su microbiota intestinal sea saludable o tenga problemas. Y luego en la edad adulta, lógicamente, ¿qué factores de vida intervienen? Por supuesto, la alimentación, no podemos olvidarlo, y la actividad física. Todo esto va a afectar ese eje microbiota cerebro que vamos a tener siempre ahí y que va a desarrollar o bien salud por un lado o bien patologías a nivel del sistema nervioso. Así que una dieta saludable es esencial. Nosotros seguimos fomentando la dieta mediterránea todo lo que podamos. Es importante para mantener una microbiota saludable y, por supuesto, que la gestión emocional, el estado anímico sea más saludable. Esto es lo que queremos, envejecer de forma saludable, porque no es dar más años a la vida, sino dar mucha calidad de vida en los años que tengamos. La inmunonutrición está para eso, para promover la calidad de vida y prevenir infecciones y procesos de inflamación, vigilando estrés, alimentación, actividad física y peso. Así que nada más, comentaros que tendremos el Congreso Internacional de Inmunonutrición en Barcelona al año que viene. Queríamos que fuera presencial en el mes de julio, estamos viendo que no va a poder ser, pero bueno, Creo que las tecnologías han cambiado últimamente mucho y seremos capaces de tener un congreso virtual igual que el que estamos teniendo estos días en FESNAT, en la Federación Española de Sociedades de Nutrición, Alimentación y Dietética. Y nada más, muchas gracias. Este es mi grupo de inmunonutrición, que muchos están fuera, y este es el grupo que está ahora mismo en el laboratorio. Nada más. Gracias.
Thank you very much, Professor Marcos, for this very interesting intervention. Now we can start the roundtable discussion, but before we do so, let's have a look at some of the facts which would be sort of like fueling the discussion that we can have with the experts and all the participants today in the field of targeted nutrition. So you all know that studies have shown that people have different responses to the same dietary components. So this makes obvious that we need to go beyond the one-size-fits-all standpoint approach, and we need to opt for targeted or even personalized nutrition approaches. So the targeted approaches can be used for a variety of populations and can be focused either on different conditions. They can deal with malnutrition, they can support healthy aging, they can promote mental health, and they can contribute to the prevention of non-communicable diseases. But they can also be used to achieve certain goals, for example, to maintain a healthy weight. And these interventions can be tailored at different levels. At larger scale, you can define target groups and then try to deal with their nutritional needs by facilitating adapted targeted diets. But you can go a step further to the individual level. You can reach what it's called personalized nutrition, aiming at a particular individual to optimize this individual's health, or again, achieve specific goals. But whichever the context and whichever is the reason why behind, there are three main points that really need to be addressed. We need to have sufficient evidence that how to direct nutrition to promote health. We need to generate and analyze data from questionnaires to the people up to sample collection. It could be saliva collection, blood collection, stools collection, etc. And then we need tools to process and analyze all this data and information. So I think we have today a panel that can help us understand a little bit where we stand with all these parameters and what are the major challenges in the field of targeted nutrition. So we have already received some questions. Some of them have been by the group chat, so there are already even some answers. But if you don't mind, I will repeat the questions, and then maybe we can invite the speakers to give their answers for all participants. For example, there is a question about the companies focusing on targeted nutrition by screening the gut microbiota. So I don't know, Dr. Kokolin, if you want to give us an answer on this specific matter.
Sure. And sorry for having anticipated some of the answers.
No problem.
Actually, let me, before answering, I mean, I have noticed that the three speakers, I mean, my colleagues, I mean, we have chosen the same background. So this is actually surprising because we had like a kind of portfolio through which to choose, and we all choose, you know, the citrus. So probably the Mediterranean roots are strong among us. So this is actually surprising, and you know, this is actually nice. No, what I was saying is that I think that gut microbiota still has a lot of potentials to be exploited, also because the field is, I would say that is not new because it has been already more than 10 years that we are talking about. However, since we have approached this, this subject or this field of research, probably in a rather fast way, because it was also very much connected to the very fast development of technologies, because we had technologies that could really be used in order to investigate in a very fast way the diversity that we had inside of our gut. So we had studies that focused more on the superficial observations without really digging into the, let's say, the mechanism, as I said before. To me, this is a field that has huge potentials. However, we really need to understand what microorganisms can do exactly when they are subjected to specific, let's say, stimulations that are arriving from the outside world. And here we have focused on food, but think about, you know, the environment, think about the exercise, think about of your lifestyle. I mean, there are a lot of different parameters that have to be taken into consideration. And then the last point, because I don't want to give, I want to take space also from the other speakers. My microbiota is different from yours and is different from the other people. So how do we need to take this into consideration? Probably artificial intelligence and machine learning will help us in terms of diversity. I always ask myself, is artificial intelligence going to be able to model behaviors? So if a cell is behaving in a certain way, can we actually be able by artificial intelligence to study it and then create predictive models or predictions that would really tell us exactly what is going to be happening in a certain scenario?
Thank you. I don't know if any other of the speakers wants to give an answer, not maybe on microbiota in particular, but maybe because we've mentioned here that there are so many companies who are selling now their products and they're saying that they're using algorithms to be able to provide with adapted and personalized diets for everyone. Is there enough scientific evidence behind for us to believe in this kind of applications right now? And if not, what is still left to be done?
Yeah, so I think that today there is no evidence to support what they are claiming as companies. I think what is being done is probably not correct from a scientific point of view. I don't see that we have enough knowledge of those polymorphisms, those variants. And even if we are addressing them with AI, following what you were saying before, even if we do it that way, it's probably not enough. Which doesn't mean that we're not on the way to achieve it in the next years. Basically, the more we are sequencing people, both the genome and the microbiome, and the more we are using the tools that I explained to be able to differentiate what is happening from one patient to another, and train those predictions, the closer we're going to be. So it's just a matter of time. It's just a matter of probably the industry wanting to rush a bit more than science is ready for, but nothing that indicates that conceptually we cannot do what Luca was asking. I mean, is there a way to model the way in which these cells are going to behave? My answer to that would be, why not? And fair enough, the complexity is huge, but we have to keep in mind that in this world of correlations and associations among variables, you don't need to control everything, every variable, to have an outcome that is helpful from a clinical point of view. So maybe you're not seeing the whole spectrum, but you have some inferences that help you make decisions, which is ultimately what you want to do. Even when you're not, by definition, probably we will never understand the whole complexity of what is happening behind at the fractal level. But even when that's the case, the outcomes may be good enough.
Okay. And maybe to get the answer of Professor Marcos, what do you think about all these companies that are also trying to sell products and technologies on the internet, taking advantage of the COVID-19 situation and saying that they have the answer of how to strengthen and reinforce your immune system? Yes. Do you think that there is evidence today and it makes sense for people to take dietary supplements to prevent COVID-19 or to strengthen their immune system as it is claimed to be?
Well, at this moment, it's true that we don't have enough scientific evidence about any product and food product anti-COVID-19. Anyway, it's very difficult to say that the product is going to be the best for health. There is not any product, any food. There is not good foods or bad foods. There is a lifestyle, and there are good and bad habits. So it's very complex. It's not only one food. And the problem in internet is that we find a lot of information, bad information, with not really good products, or at least there is no scientific evidence. So we have to be very careful about that. And nutritionists and all the professionals related to health have to be concerned about that, and how to advise the consumers, the people in general, to say be careful, because not everything in internet is okay, no, it's good, it's true.
Yeah, so despite the fact that there is scientific evidence, and every day there's going to be more, because it is a field where there is a lot of research going on, we still haven't reached the stage where all the messages that are being transmitted to the consumer are 100% scientifically robust and validated. So the obvious question is, how can we reinforce the research and then also control the messages that are being transmitted to the consumer? What do you think that should be the next steps in order to be able to accelerate the process? Because there have been results of studies showing that different people have different responses to the same dietary components, which means that this element of personalization is there, is present, is real. So what are the first elements that need to be addressed at this stage in order to be able to generate this missing evidence?
Well, I think that the first thing is to do some nutritional education, and this is very complex, because it is something that is all the governments should have a project like this to educate consumers, starting by infants, children, but also their parents, their teachers. It's not easy. It's should be a very whole project, and all the not only scientists, but all the people involved in nutrition, in health, should be collaborating. So it's something that could be very expensive, and governments should know that it takes a long time too.
Yeah, sure. And in terms of technology and research, because we're here in the EIT Food Forum, we want to support and we want to prioritize innovation and technology. What do you think? This is an open question for any of the speakers, and maybe for the members of the audience. This is meant to be a discussion session, so we're inviting you to participate. You can either send your questions to the speakers, or raise your hands, as we said, and ask them a question. But I would like to have at least the panel's opinion on what do you think are the elements that, from the scientific and technological point of view, are the next to be dealt with in order to advance in this quest for targeted or personalized nutrition?
Well, regarding personalized nutrition, we have the best scientists in the world. So Jose Maria Ordovas, probably you can answer.
He will definitely give us a lot of answers.
Yeah.
In a few minutes left. So to wrap up, I don't know if Luca or Ignacio want to give their views on the next big thing on science and technology in the area of targeted nutrition.
Now, what I wanted to, I mean, I'm aligned with what has been said before, with both with Ascension and also with Ignacio. I think that if I'm thinking about what is necessary to be done in this field of that is extremely fast by the technological point of view, so I agree 100% with Ignacio that this is something that is going to come. For sure, is going to come. I mean, there is no barrier in the implementation of targeted nutrition, also even personalized nutrition, okay? I would say that we need, at least from what is the field that is more close to me, that is the microbiome, we really need to take to the next level, in a sense that we need to look into specific mechanisms, because probably, you know, one person is reacting in a different way because there is a specific mechanism that is taking place in one individual and is not taking place in the other individual. Let's not forget about the fact that complex ecosystems are communicating between each other. So the way the reaction to the stimulus that is coming from the outside may also be related to the ecology of the ecosystem. So that's why probably if you feed a specific component to one individual and you have a reaction, and you feed the same constituent to another individual, you have another reaction. It just can be a matter of diversity, and because of the diversity, then you have a different outcome. So this is, to me, what we really need to do, because as we said before, we cannot, and actually I'm getting a message from I'm using a word from the chat, we cannot fool with the consumer, because, and especially if we think about food industry is coming out from a huge crisis because of distrust, because of loss of trust from the consumer. So if also in terms of nutrition and personalized nutrition or targeted nutrition, they will do the same mistakes, then really we have a problem.
Yeah, I mean, you are the experts in microbiome, but from my perspective, which is the machine learning view, we're as people trying to generate prediction for patients, we're always, as I tried to explain during my talk, we're always looking at new data layers with which we can feed our algorithms. And even not being an expert, what I can say is that 2019 and so far 2020 have been impressive years, in the sense that we have seen through articles how the predictive power of the microbiome has even exceeded that of genome-wide association. When you look at the studies in discriminating complex human disease, we have seen how it has. We have been able to report the impact of nutrition on predicting glycemic responses, on even in disruption of fertility, in pancreatic cancer outcomes. It has given us clues to liver disease. We saw that on Nature. We have seen a lot of longitudinal multi-omics of host microbiome dynamics in pre-diabetes. We have seen this microbiotas predicting mortality in allogenic hematopoietic cell transplantation. We have seen how in Nature, how type 2 diabetes influenced compartmentalization in human obesity. We have seen it impacting colorectal cancer with regards to metabolomic analysis. I mean, we have seen so many things that we are, even when it's not our field, we're very hopeful that the more we include this new knowledge into our abilities to predict, the more successful we're going to be. Whereas maybe just 2 years ago, we were all concentrating just on genomes and maybe clinical records. But this is getting bigger, and we're seeing it across all specialties. Also for cardiomyopathy, microbiota has proved to predict as well, and there are so many cases. So I think it's worth to remark.
Can I be one step provocative here, because actually I was listening at what Ignacio was saying and all the correlations that he was enumerating. As in my introduction, I mean, you have heard that I'm editor-in-chief of the International Journal of Food Microbiology. So recently, and this is actually connecting to what Asuncion has presented in her talk, I received a paper in which there was a correlation between the incidence of COVID-19 and the consumption of foods of animal origin. So basically, by the risk and the threat that we have by having these super powerful tools is to actually get correlation with anything that we want and with anything that we need. So this is, you know, to me, we need to be very careful of have these kind of tools in the right hands, because again, we literally can get I mean, whatever we want out of those kind of tools. I don't know if you agree with me or not, but I mean, this was just a kind of, you know, like little experience that it happened to me. Of course, the paper was rejected without even reviewing.
Yeah, there was many things. I agree. During the COVID, yes. During the pandemic, we saw people correlating things that were absolutely crazy and nonsense. Yes. And that's why human context is always needed, right? And we know that. There's even some literature already that proves that when you put only dermatologists, and it doesn't work that well. If you put only machines, it doesn't work that well. You put both, it works the best. So that's probably what it's going to be. It's like, you know, the MRI, the magnetic resonance, when it appeared, we as neurologists, it seemed that it was going to diagnose everything. And there was no need for doing anything else. But then it's not true. You need MRI and you need human interpretation of MRI. And I don't think it's going to be different with artificial intelligence. There's going to be a need for looking for plausibility and clinical meaning, so to say.
Well, I still think that it is very important to prevent, and before the infection comes, just if you have healthy nutritional status, you are going to be less risk to have any infection. So first of all is to prevent. And then if you take care about your nutritional status, you are not undernourished or obese, you are going to have less risk to have any infection, especially this one, for sure.
Okay, so I think that it's very clear that there's quite a lot to await in the field of targeted and personalized nutrition for the future. It is a field that will definitely evolve and will give us a lot of yes. interesting evidence and data and tools. And it is like a cross-specialty collaboration, because we need the scientists, the medical doctors, but we also need data scientists, and we also need the tools to interpret all this information. So I think we'll be looking forward to see all the progresses that lay ahead. So with this line, I want to conclude this session. I would like to thank all the speakers, Ignacio, Luca, and Ascension, for your talks and also for your valuable contributions during the discussion session. And if you agree, we will proceed to the last session of today, which is our key speaker intervention on nutrigenomics and targeted nutrition, for which we have a double bill. So we will start with Dr. Jose Maria Ordovas, who practically needs no introduction, but I will give a short introduction nonetheless. So Jose Maria Ordovas is Professor of Nutrition and a Senior Scientist at the USDA Human Nutrition Research Center on Aging at Tufts University in Boston, where he's also the Director of the Nutrition and Genomics Laboratory. In addition, he's Professor of Genetics and Pharmacology at the Sackler School of Biomedical Sciences and a Senior Scientist at Indea Food in Madrid in Spain. Dr. Ordovas's primary research interests focus on the genetic and epigenetic factors predisposing to age-related chronic diseases and their interaction with environmental and behavioral factors, with particular emphasis on the diet. He has published over 850 scientific articles, has written books, and has participated at hundreds of international congresses and symposia related to personalized nutrition. In this regard, he's considered a pioneer and one of the most distinguished world experts in gene-diet interactions pertaining to cardiometabolic threats. So with a great pleasure, we welcome Dr. Ordovás, and we will hear his presentation first, and then I'll introduce you to Dr. José Ordovás Montañés, who will give the second part of the presentation. Or should I do it both at the same time? Are you going to be using the same presentation?
Yeah, go ahead.
Yes, but
okay.
In terms of the order, the other Jose will go first.
The other Jose will go first. So I will give the other introduction as well. Yeah. So José Ordovás Montañés is a principal investigator at Boston Children's Hospital, assistant professor at Harvard Medical School, and associate member of the Broad Institute and principal faculty at Harvard Stem Cell Institute. He received his PhD from Harvard University, where he studied how the nervous and the immune system function together as the principal sensory interfaces between the internal and external environments. His research group at Boston's Children's Hospital seeks to understand the principles of how inflammation drives memory formation in human barrier tissues. So for this presentation, Dr. José Ordovás Montañés and Dr. José María Ordovás will be talking to us about a tale on two pandemics, COVID-19 meets obesity.
So, thank you very much, and y muchas gracias por la invitación para estar aquí con todos vosotros. I'll be presenting in English, but if anyone wants to ask questions in Spanish or English, it's completely fine. So thank you to the organizers. It's a pleasure to be here today. And we'll be sharing some of our, I guess, evolving thinking into this tale of two pandemics, one which is relatively new for us and one which is a little bit better known. So with the first part of this, I want to discuss a different level of resolution than what's been primarily discussed today. So far in the last session in particular, we've heard a lot about the kind of impact of the microbiome on the host and also the difference in host genetics. And there's a key layer that's been missed in there, which is really the cells as the interpreter of the genome and who these cells are and how they're functioning within these tissues with which they delicately interact with our external and also internal environments. So I'll be describing some of our recent work into the single cell biology of COVID-19, and at the end tying this back into the intestine, of course, the principal site where food is often encountered. So I'll start with a little bit of a personal view on COVID-19. So I think that we're all well aware of maps like the one on the left, looking at the global impact, and we can see that there's tremendous diversity within the either productive or non-productive responses that different countries have had. And unfortunately, where I'm speaking to you from today, which is in the United States, we've had rather a poor response to this pandemic. And also amongst European countries, Spain has also been disproportionately affected relative to others. And this could be for a variety of different factors that we're still trying to understand. And we can also appreciate that this heterogeneity is also within our more local communities. So this being a map of Boston, and within the neighborhoods in Boston, there's still different disparities, again, set up for different reasons that we need to understand better. And this is paralleled in a way by the way that this virus impacts our bodies and the different organ systems within, and even down more locally to the level of individual cells. And so the question that I'll pose to start off with is just how far do we need to go to really understand the diversity of how this virus is impacting our society? So what my lab typically focuses on is this. It's a series of tissues known as barrier tissues. A few of them that are quite prominent are tissues like the skin, the gut, or the airway. And the main question that we ask are which cells adapt to and remember challenging situations. And so the collection of cells here, and we'll go into increasing layers of heterogeneity during the talk, are principally characterized as epithelial cells, so the 1 or 2 cell layer thick that divides us from the outside world. The stromal cells, which help to provide supporting structures and allow for the vasculature to form and exchange nutrients and oxygen. Also neurons that allow us to sense the outside world, and immune cells that are there to kind of protect and clean up. And so these tissues are tasked with dealing with a distinct set of different inputs, whether it be something like a virus such as COVID-19, or nutrients, whether they be beneficial or detrimental to the host, and a variety of different injuries. And so while we might originally study each of these in the context of more specific cellular populations, it's becoming increasingly clear that with each input into a tissue, there is a collective response that is distributed throughout the entirety of the cellular ecosystem illustrated here. And we hope that in the process of coordinating that response, we are able to measure the appropriate level of defense or metabolism or repair that that tissue needs to call upon. And so what we primarily do is we generate and we study maps of these tissues to find the cellular basis for health and also various inflammatory and infectious conditions. So how did we first encounter COVID-19? I think as with many of us, based on our own expertise, we had our own particular biases. So, you know, maybe I'm, for example, the scientist here pointing at this elephant and I'm thinking that it's only a spear, right? And there's also a scientist here on top and he thinks that it's only a fan. And then, you know, there's the scientist back here who thinks that hydroxychloroquine is going to solve everything. And clearly by now, I think we know that was a little bit premature to conclude. And so over the past few months, we've gained a tremendous amount of information about this, and we're starting to get a clearer picture, but we're not quite there yet, right? We still need better understanding on prevention and treatments and curative therapies to be developed. Our other kind of first understanding of this virus was really enabled by rapid genetic sequencing of what we were dealing with. And here in this beautiful illustration from El País in a few months back, we can see that this virus is literally 29,903 letters of bad news. So it actually, if you were to spread it out over a newspaper, it only fits on 4 pieces of newsprint. And so it doesn't even have, you know, paragraphs or sentences. It kind of divides up its different genetic elements with semicolons effectively. So it invades the cell with one stretch of these 29,000 letters. And now, of course, once we had a little bit of understanding, we needed to understand what does it actually want to do with them. So viruses, of course, want to find a series of hosts to allow itself to replicate and spread. And the more successful the virus is going to be based on how rapidly and to how many individuals it can spread, not necessarily how quickly it might be able to kill. And it seems like this virus has this amazing ability to stretch between effectively asymptomatic individuals to causing lethal disease in an unfortunate number of individuals. And so we needed to start to understand what are the parameters that regulate these possible outcomes. So a little bit more understanding about COVID-19 started to come out of some of the initial case series, and we started to hone in on some of the primary tissues where clinical symptoms were being reported. Now, being a respiratory virus related to other coronaviruses, the nose and the lungs were obvious sites of potential infection, but then there were also some other insights into intestine, perhaps being a site of potential infection. And now, of course, we've learned about many of the other complications that exist throughout a variety of physiological symptoms. So another element that I think here was really important was actually just how this pandemic evolved throughout the world and when different scientists and when different research groups started to drop other things that they were doing and turn their attention towards this virus. So here, you know, I'll highlight again this importance of kind of local and global connection that exists nowadays, because for me, it was actually starting to read the news in Spain that got me particularly concerned about this virus. So, you know, obviously the emergence of a lethal pneumonia coming out of China was already enough to spark alarm. But then I think for many in Europe, it was when Italy and then Spain eventually were hit quite hard by this virus of pandemic potential. And then in the United States, I felt like we were almost looking into a not so distant future. And it was like watching this tsunami in a way evolve that was only going to take a mere weeks to arrive. And so I said, you know, after seeing a bunch of headlines in the Spanish newspapers here highlighted in red, by the end of February, after seeing a few reports and series, I said, you know, we really need to turn our attention in the lab to understanding what this virus can do at the level of our tissues. And clearly in March, this became really the main focal point of our attention. So let's zoom back out and then scale back into what we've started to learn today. So as I mentioned, there's tremendous heterogeneity in the way that this virus has impacted different countries. And you'll note here that there's several countries in red reporting quite high prevalence of viral infections. And there's also no countries really that have reported no cases. So this highlights that this is a highly connected globe whereby things like planes have allowed this virus to spread quite rapidly. But, you know, even within those countries that are completely red, we can appreciate that there's meaningful heterogeneity within them. So here looking at a map of the United States, and this is from mid-June, this map has shifted substantially since then. We can appreciate that there were differences in the way that this virus was spreading, again, going down into the individual state. And so you kind of ask yourself, well, how far do we really need to go? So for us, you know, it doesn't stop with understanding the epidemiology of this disease, but rather we want to understand how it impacts the individual person. And so what we had been doing in the lab was to understand how these tissues in individuals are really changing based on a variety of different inflammatory conditions. And this is why we were poised to shift our attention towards something like SARS-CoV-2, even though it was new to us, as it was new to many of us in the scientific community. And so what we had been doing in the lab was collecting tissues like, for example, the nose and the upper airway, which I'll focus on over the next few slides, and comparing them between healthy individuals here in green and the purple individual here who has a particular manifestation of allergic inflammation in their tissues. And we can appreciate that there's certain large changes that we can appreciate under a microscope, simply schematized here in this cartoon. And so what we do is we make maps of tissues at single cell resolution. And the maps that we make are based on the individual cells within them. And the individual cells are characterized, and we learn about them by understanding their patterns of gene expression. So rather than reading out the DNA, we're reading out the RNA, we're reading out the transcriptome of these individual cells. And I'll illustrate what the main power is of getting single cell resolution as opposed to bulk resolution, which is what had traditionally been done on this slide here. So if we focus on this bulk RNA sequencing part on the bottom, if we took this tissue, this collection of cells, and then put it into a media that lets us isolate the RNA, then what we can do is we can effectively get 1 point, right? So each individual is going to be represented by 1 point in our eventual analysis, and that point is going to collect information from the 20,000 or so genes. And we might be able to say that in individuals in healthy situations, they have certain patterns where these genes are higher than others, and individuals with sickness might have slightly different patterns within all of their different genes. But we've completely lost cellular resolution. And as we know, there's tremendous diversity in these tissues. We have epithelial, we have stromal, we have immune, we have, in some cases, neuronal cells that we can capture. And so what if we were able to actually ask every cell who it is and what's it doing in that tissue? And so we've developed methods, along with many others, to allow us to capture individual cells. And now instead of 1 data point from any one individual, we can get several thousand data points. And so what that lets us do is it effectively lets us act like a teacher and educator in a way, where instead of looking at a collection of students, here is kind of a sea where we don't really understand anything particular about any one individual. We know exactly what every cell or every student in our classroom, who they are, what their name is, what they like to eat, and what they wear on Tuesdays, for example. And so I think that in order to understand our tissues, we really need to understand who these cells are and how they are functioning collectively. So what types of cells do we find in these tissues? So here's what a map of the nose looks like to me. So it doesn't necessarily look like a nose per se, but this is what it looks like when we display it in a way that allows us to reduce all of the complexity of the individual cells into a two-dimensional space that we can understand. And so each individual point is a single cell, and what we're looking at is the representation of how thousands of genes are allowing us to characterize these cells and place it in two-dimensional space. So here in blues, I've colored in the epithelial cells. In the pinks and the reds, we have the immune cells. And in the greens, we have the stromal cells, so the fibroblasts and endothelial cells. And so this is schematized here quite simply. Again, blues, epithelium, green, stromal, red, immune, and then neuronal, we weren't able to sample in this study based on the fact that their cell bodies are living distant to this particular tissue. So each individual point is one cell, and then the cells are grouped into clusters that are similar to each other based on their high dimensional representation that we've reduced into a lower dimensional space. And for the aficionados out there, there's many clusters of cells within these various types, so we can go deeper and deeper. And so if we continue to iterate on our analysis and ask how deep we can go, we can find dozens to even hundreds of clusters of cells. And the main question is, is there any biological meaning to these end cell clusters? But for the purposes of today, I'll keep it straightforward. So as I mentioned, in the lab, we focus on this idea that to really understand diseases in patients and also health in patients, we need to generate these maps of tissues and do so at an individual cell resolution. And so we've generated these maps of tissues from a variety of different target sites, so the intestine, the skin, the airway, and a variety of different types of inflammatory conditions, just illustrated here. We also go in and validate some of our findings and do functional tests to understand what this might mean. So of course, as we've heard, correlation is not causation. And so we need to go into the laboratory and actually test some of the hypotheses that emerge from these data sets. And so here we could rapidly turn our attention based on existing data to ask questions about SARS-CoV-2. And the reason for this was really because of pioneering studies that gave us a hook. It gave us a particular handle, and it basically allowed us to pretend that if we were the virus and we know what receptor we're looking for, we could start to look amongst these collections of cells to ask what cells does the virus target. So to refresh, the virus uses a particular protein called the spike protein. And again, here I'm borrowing illustrations from El País. And it is trying to hunt for the human receptor ACE2 on a putative target cell subset. It co-opts also human TMPRSS2 to cleave spike protein, activate it, allow for the virus to bind to host cells, and then deposit its 29,000 base pair viral genome. So it's using human ACE2 and human TMPRSS2. And based on these biochemical studies that were done early on in the pandemic, we could start to use these to look amongst the collections of hundreds of thousands of cells, together with dozens of other investigators around the world, each focused on particular tissues, that allowed us to gain some understanding onto what cells does it target. So we started to look within the nose, the lung, and the intestine as the primary barrier tissues where symptoms had been reported. And within the nose, starting first, we identified that it was actually these two receptors, ACE2 and TMPRSS2, amongst all of the cells here, were expressed on only a small subset of cells. And we termed these secretory goblet cells, so cells that help to make mucus in these tissues. And these are highlighted here by these black points. Now, at first, this seemed like such a small fraction of cells that we didn't really necessarily believe it ourselves. So we turned to our colleagues and we asked, hey, do you see this in your data? Do you also see this in your data? And a variety of groups started to corroborate these findings. So we started to have a little bit more confidence in what we were seeing. We also looked within the lung and we found this to be on type 2 pneumocytes, these cells that help not to exchange oxygen directly, but to keep the alveolus open. And then within the intestine, this is actually where we saw the greatest frequency of cells expressing ACE2 and TMPRSS2 on absorptive enterocytes, of course, critical for absorbing food, as their name suggests. And so what this study did, and we published this in late April, early May, was generate a series of predictions to test. And here I just want to take the opportunity to thank the graduate students that rapidly dropped everything that they were doing for their thesis and started to work on these studies, and also Alex Shalik, who is a key collaborator in this work, along with the Human Cell Atlas Lung Biological Network. And so based on these studies, we had a variety of predictions. And if I had presented this to you last month, this is kind of where we would have been. But over the past month, and encouraged by the organizers to share some new data, what we've done now is to be able to actually go in and test what are the direct cellular targets of SARS-CoV-2 infection and how do bystander cells respond in the nasal mucosa. So here, partnering with the University of Mississippi Medical Center, Boston Children's Hospital, where I'm based, and also the Broad Institute, where I have an affiliation, we used cells coming off of the same nasopharyngeal swabs that are used for viral testing. We put these swabs, or our collaborators in Mississippi, really on the front lines of this, put these swabs into a cell viability preservation media, shipped these up to us in Boston. We used our single cell technologies, and then we were able to unravel the host cell identity, but also look for viral RNA itself. And we had a relatively well-balanced cohort, and this is looking at slightly older individuals. And here I want to highlight the large team effort, here only able to capture a few of the individuals, but it's really been fantastic to work with everyone here. And so what we were able to do, we were able to make another cellular atlas where we were able to recover this beautiful heterogeneity of cells present in the upper airway, nasal, and pharyngeal epithelium. So we can look at the stem cells, the progenitors that give rise to the tissue down here at the bottom, the goblet cells that make mucus, the ciliated cells that help to sweep particles away, and then a variety of infiltrating immune cells as well, like macrophages, T cells, B cells that are making antibodies, and so forth. And so what we were able to do was start to look for changes in cell proportion, but more interestingly, as I highlighted, we could actually look based on our molecular understanding for these 29,903 letters within all of our data. And you can see here that using our methodology, we're not detecting this within any of our control individuals, suggesting that it's technically sound. And we could see quite striking heterogeneity, unlike what one might see, for example, in influenza infection within COVID-19 positive donors. And furthermore, we were able to resolve this primarily to the goblet secretory cell cluster that we had predicted. And so something that we're looking into now is how are these viruses actually hijacking these particular cells? And if we consider an analogy between people and cells, do these effectively constitute maybe super spreader cells within our organism? So what we've done now is we've started to share this data broadly because we only have a certain subset of domain expertise. And so we've put this up on 2 publicly available data portals. Links are available here. This was work that was rapidly funded thanks to the Chan Zuckerberg initiative. And we're excited to see what the scientific community can do with this data. And we'll continue to update this over the course of the coming weeks. And so just to close out and then transition over to the other part of the presentation, what we've really been focused on is using these maps of tissues is our ability to resolve both known and also potentially unexpected roles of a variety of our cells and tissues. And so what we've done is in studies where we have even more power, more individuals and more individual cells from them, is to go deeper, not only to understand cell lineages and cell types as I was describing, but really going into understanding cell states. What are they doing at that moment? And how is that cell state, how they're feeling at that point, altered in disease? And so to wrap up and come back around to the intestine, and if there's anyone here who has interest within inflammatory bowel disease or other inflammatory manifestations in the intestine, I think that we're particularly very excited about this work, and I'd be curious to hear the expert opinion of folks here in nutrition. So partnering with folks at Boston Children's Hospital and also at Seattle Children's, Leslie Keene, Betty Zhang, and Allison Yu, we've been able to generate an atlas of treatment-naive pediatric inflammatory bowel disease, absent therapeutic interventions and really at diagnosis to understand how their cellular and also microbial phenotypes are associated with their outcomes to disease and also to treatment. And so this is my last data slide. What we've been able to do is again generate an atlas at larger scale than what we've been able to do before, and really make this amazing cellular taxonomy here. And so now what we're interested in doing is to identify which cells or which cell states are really responsible for driving and sustaining disease. And one thing that I've really learned in discussing with all of my collaborators is that the role of food, paradoxically, in intestinal inflammation inflammatory diseases is actually highly misunderstood still. So I think that there's a lot of opportunity, perhaps with investigators in this group, to pursue that further. So with that, I'd like to acknowledge all the members in my laboratory and also funding sources. And I'll leave my email here, website and Twitter link in case anyone wants to reach out. And so with that, now we'll scale back out to the level of people, and I'll switch over and stop sharing so that you can share on your end.
Thanks so much. That was a great presentation. And as you say, we are going to now move from that stratospheric future that you were describing more towards the present reality and focusing on the human. I like also to thank Afrodita for the presentation. It was also interesting to see the panel discussion that we had before, and I was muted, so I couldn't participate. But I will put my my 2 cents worth now in terms of trying to answer some of the questions that were raised in the previous hour. Okay, so as I say, now let's go back to the whole human. And in the same way that Jose was going from global and local responses to COVID, here we are going from the current situation that one size fits all in terms of the countries, in terms of the world, the dietary recommendations, to that need of personalization in terms of response to these chronic diseases that affect the society nowadays. This is something that we all agree. And this is what we have in the title. We agree, well, at least we tend to agree, that a healthy diet is the solution for everything. And you can see there the introduction to so many scientific articles. And you can see it also in the popular press, right? A healthy diet is the easiest way to, a healthy diet is the most efficient method. A lack of a healthy diet is the main cause of many diseases. So I mean, at least we agree on that. The question, that's something that we don't agree, is what a healthy diet is. And the public doesn't agree. But this is because the experts don't agree. So if we ask a series of world experts, leaders of opinion in terms of nutrition, in academia, in medical societies, about rating over 100 foods, if we all knew what a healthy diet is, that's the answer that we'll get. We'll be rating bad foods, if we can say that, in red, and good foods in green. And there will be some, yellow area in between. But this is the ideal situation. Now, let's go to the reality. When we took 13 independent experts, most of them in the US, and asked that question, this is what we got. I mean, the answers were all over the place. And it's true that, most of us agree on what is less good and what is better, right? But in the middle, different people have different opinions. And you can see how some people classify as red or bad, well, some people classify as green and vice versa. So this is the reality, and this is why things are the way that we are now in terms of the nutrition field and in terms of the recommendations. And why? We are complicated, and food is complicated, as there is no question about that. We are complicated. I mean, we can see that in any study that we have performed, and it will be performed, is that when you put people on a diet or different diets, you have a whole range, a spectrum of responses to the same diet. Here we have the work of my colleague Christopher Garner in Stanford with diet feeds, and you see that some people increase weight and some people decrease weight with the same diet. And it doesn't matter which version you use, you have the same variability. So yeah, we are complicated. And food is complicated. And that's the translation of a news clip that I published, I wrote many years ago in 2011. So what I was saying is that food is complicated, and I illustrate that with this piece that I wrote a few years ago for the popular press, and says, however, nutrition is one of the most complicated areas of science out there. First, we don't know our food. And again, as Grande Cobian said, and Grande Cobian was, as I said before, although you don't hear, was my mentor and one of the fathers of the modern nutrition, and even the humble potato contains thousands of chemicals. Some of them are known, most of them are known, and there are so many different varieties of potatoes. So we have the complexity of the food. And more we are realizing that. And here we see the headlines today. Hidden nutrition. We don't know what makes up to 99% of our food. And in order to put light into that darkness, we have this initiative from the Rockefeller Foundation, the Periodic Table of Food Initiative, that is going to precisely to uncover what is in that other 99% of our food. What, I mean, probably not the 99%, but if we get about 60%, we'll be happy. So that's the reality. So we are talking about personal nutrition. We have not defined personal nutrition. I see that as an input and an output. The input is that we collect as much information as possible from the individual. We take that, we process it through that artificial intelligence that Ignacio was telling us about earlier. And then from that comes different recommendations. We can design different products and so on and so forth. And then the output is that we will be able, at least we aim to achieve a lasting dietary behavior that will bring health to our lives. With that, we have been investigating what is behind that dramatic variability that we see in response. And our target initially was genetics. It was obvious, right, in our mind. But then with time, we were just getting into so many other factors, right? For example, sex. It has been ignored. Usually the statistician adjusts for sex and that's it. But no, we have to examine the difference by sex. Age is also a factor. Young people respond differently than elderly people. Microbial. Luca talked about that. And we will realize more and more the importance of the microbiome. But also a factor that I will touch very briefly is the chronobiology, the circadian rhythm, the chrononutrition. And then obviously it depends on our baseline, whether we are obese or not obese, diabetic or not diabetic. Things are going to be different recommendations. And an area that we have to go deeper and deeper is the epigenetics, because after all, epigenetics is the bridge between the environment and our genes. Okay, so just a couple of examples. The fact that for some, good is better. And here we are talking about the Mediterranean diet. And I'm going to show you an example that some of you have seen already or have read about it. And it was based on the PREDIMED study. And you know the design of the PREDIMED, 3 different arms, one with extra virgin olive oil, the other one with nuts, all of them in a Mediterranean background. And then the control diet, that was not a bad diet. It was the diet that was recommended by the American societies for a long time, which was the low-fat diet. And here we are going to put it in the context of genetics, and that's that title of something that is good, as we think is the Mediterranean diet, could be even better for some. Here we have a genetic polymorphism that is associated with diabetes, and it has been validated in different populations, and that's what happens here in the case of the PREDIMED. This polymorphism that you see up there in the TCF7L2 gene, you have different genotypes, and each one of them associated with a different risk of diabetes, but in this case, a different risk of a stroke. So this is incidence of stroke through the 5 years of the duration of the study. And you can see different incidence of a stroke depending on the genotype. Okay, so TT, obviously they are not doing very good, and they have more incidence than CC. Now let's go to the group that were receiving the Mediterranean diet. And what we see here is that overall, the Mediterranean diet was beneficial. But for whom it was more beneficial? For those that were at higher genetic predisposition for the disease, in this case the TT. In fact, it has just merged all the different genotypes. So genetics start to play a minor role in the outcome of these individuals because of the environment, because of the diet, because of the proper diet. Okay, so if we made a model of what happened during the duration of the study, what we have here is that 44 cases of a stroke were prevented by these people taking the right diet for them, which was the Mediterranean diet. And you will say, well, big deal, right? It's 44 people in 5 years, and doesn't look too much. But think about the individual. For the individual that didn't become a case, that was very important. But what about the society? Let's look at the numbers. 90,000 new strokes per year in Spain. Just by taking that this preventive measure, we could have prevented 9,000 of them. So personalized nutritional advice is important, and it has an effect on the individual and the society. And also an important message is that it's not too late for prevention, because these people were at high risk and they were old. And despite that, there was a beneficial effect. And then we have the other side of the coin, that some things that are bad, they are not as bad as it might be for some people. And here we have some of on the left our studies, and on the right studies of one of my former students, Lucy, that shows that with one of the foods that has been more attacked in the last few years, which are the sugar-sweetened beverage. And this is a recent work that we published, focusing on one gene, which is the PAMT. And then what do we see is that depending on the form of the gene that we have, if you are CC, it doesn't matter if you drink. If you don't drink, if you drink little or you drink more of these beverages, in terms of BMI. But on the other hand, if you are CT or TT for this polymorphism, you really have an effect on the BMI. So again, precision nutrition, you can select people for which you have to have a much more intense recommendation, and others that you can just let them a little bit go on their own. And this is with one single gene, and that comes to another point of discussion probably, which is, well, can we base things on a single gene? In an academic study with everything under control, yes, but in real life, we have 20,000 genes with variants in many variants in any one of them. So we have to take a more comprehensive approach, which is the genetic risk scores. But we see the same situation here with genetic risk scores for BMI. We have here, I don't remember, about 100 different loci, and then we do a genetic risk score, and depending on your genetic predisposition, whether you are in the first quartile or the fourth quartile for genetic risk of obesity, the impact of those beverages are going to be different. Let's focus on the last, on the poll results, and you will see that if you have a low genetic predisposition for obesity, well, if you drink or you don't drink these beverages, that's going to have very little impact on your BMI, but as you grow in terms of your genetic predisposition, it's having more and more impact. So this is a point again of personalized recommendation in the future. Now, another point is that, I mean, who are traditionally we talk about you are what you eat, but also we have to put into the equation that you are when you eat, and that comes the chrononutrition. And there are many factors that affect our circadian rhythm. The age, the sleep, the kind of work that we do, the social and physical jet lag, ethnicity, and genetics, of course, because the circadian clock is defined by a series of elements that are coded by different genes, and those genes have different variants. So that is going to have an effect. If we have a circadian rhythm that is in synchrony between, let's say, our central clock, which is in the brain, and our different organs, then everything's going to go okay, and then we'll have healthy metabolism, will not develop obesity, and so on and so forth. So we have a healthy phenotype. Now, if for one reason or another, whether it's genetics or environment, we desynchronize that circadian rhythm, the outcome you see it on the slide also, type 2 diabetes, mood, obesity, and so on and so forth. So chrononutrition can become very important in the future. And I'm going to bring you an example of that. This is work that we did in collaboration with Marta Garrolet in Murcia. And she has a program for losing weight with Mediterranean diet, behavior, and so on. And what we observe is that, well, the success of these individuals to the program, it was different. Well, to expect that. We have seen that variability in any study, but there was something that makes people more successful or less successful. That is represented in this figure. It depends on the time in which you eat. These people were eating the same, but some people were more successful than others. The ones that were more successful, they were having earlier lunches than the ones that were less successful. So based on that, you can say, okay, well, let's add to the recommendations about what to eat, when to eat, and let's say that people eat earlier. Well, is that true? Is that something that is going to apply for everybody? And when we put that in the context of genetics, and in this case, a gene that is expressed primarily in the adipose tissue, is the most expressed gene in the adipose tissue, which is perilipin. This is what we saw. There we are. It depends on the form of the gene, the time of eating is going to have an effect or doesn't have an effect in terms of losing weight. So you have the T carriers for this polymorphism, that it doesn't matter if they eat earlier or later, they are going to be successful, or at least there's not going to be any significant difference. And that's the panel on the right and the panel in the middle. You can see that a very large effect coming from those that are carriers of the AA genotype. In those people, yes, you can go there and say, well, you know, yes, you are doing well with your food, but you have to go loop the loop and go a step further and say, you have to change your eating style and then eat earlier, because that is going to bring you the benefits, the full benefits of the diet that you are consuming. So this is an example of chrononutrition based on genetics. Obviously, this is not going to be the unique answer for the future, because there will be many other genes. But in this study, is a proof of concept of the importance of chrononutrition and the importance of that personalization that is you can bring with genetics. And there is another aspect to the chrononutrition issue, how we spread our foods during the day. And that is that's data from Predict that I will describe very briefly in the next few slides. And here what we have, we don't change the time, we change how we distribute our foods. So we have a breakfast and we give different breakfasts, and you have there potato, pasta, rice, different types of bread and so on. That's fine, and people have a different glucose response depending on what you eat. But what was amazing is that when comes the time for lunch, you give them the same thing. And then again, you have different responses, and those are driven for what you by what you ate before. So it's not only the time, it's only how and what you eat, but also how do you distribute the food through the day. So why are we now so interested about precision nutrition? There are several factors. One, and many of them were brought up already earlier in the meeting. For example, we understand much more about the microbiome. We can generate so much data nowadays with those omics, and it's getting cheaper and cheaper. But very important, we are able to take that data and put it through artificial intelligence. But I mean, don't, as Ignacio was saying, you cannot just go there blindly and put the data in the computer and just let them spit results. You have to really process that with your own brain, right? And then we are gaining more technology also in terms of measuring ourselves, our exposure, what we eat, how much exercise we have. I mean, we have these watches, these phones, and so many other biosensors that are developed. But we need population studies, we need intervention studies. And for example, in the case of those studies, we have the new initiative from NIH, which is All of Us, that in which 1 million people will be followed for 1 or 2 decades in terms of asking all these questions, right? But this is the future. The present is in that Predict study that I mentioned to you already. But most important, we have received the seal of approval. Francis Collins has published a few weeks ago this article that says precision nutrition, the answer to what to eat to stay healthy. So now, based on that statement, based on that recognition and based on the support that the NIH will be providing to the precision nutrition, will be able to move faster and also on more solid grounds. So let's go to that predict that I keep talking about. This is the ideal collaboration, in which you have different institutions with different expertises, different parts of the world, King's College, Massachusetts General Hospital, Stanford, Harvard, Tufts, and also the private sector. SOI, this is a tech company that is specialized in artificial intelligence and machine learning. So we put all these efforts together and we come out with Predict. Predict has different phases. I am going to describe very briefly. Predict 1 was published in June in Nature Medicine. And what we have here is about 1,000 people, in which in one day you really get all the possible information from them in terms of bringing them to the clinic, doing blood testing and all kind of testing. And then for the following 2 weeks, they go to their homes, they keep eating different meals that we provide, but they just do their own measurements at home. So talking about big data, this is big data. It's true, it's only 1,000 people, but look, I mean, we gave them over 32,000 muffins. We collect information on over 100,000 meals, more than 2 million of glucose measurements, 28,000 of triglyceride readings, and obviously all the other information that was collected during this time. And we see what we have seen in every study, a huge variability. But very important, in this case, we not only tested, as many observational studies, the fasting state, we tested also the most common state in humans, at least in the Western societies, which is the postprandial state. And this is what we see here, how the response of people evolve through time after they have eaten. So that's a very important component and unique to this study. But anyway, you see variability in triglyceride, tremendous variability in glucose, and the same thing for insulin, and it's larger in the postprandial state than in the fasting state. So if you are talking about responses, obviously you have to look into the postprandial state. Another thing very important that came out from Predict is that most of these people were twins. And what is the role of genetics in what we see? Well, in terms of height, well, it was a very good correlation between twin number 1 and twin number 2. But when it comes to these glucose responses to food or the triglyceride responses to look, yeah, I mean, you can see a correlation if you look hard, but it's a cloud. It's a huge cloud. So people with the same genes, they tend to have a significant, statistically significant response that is similar, but in practical terms, it goes all over the place. So genetics plays a role, but it's not the major role. So if we feed that into all this artificial intelligence and machine learning, what we get is that there are different components that affect that variability, and they are different for triglycerides and for glucose. And here you have different measures like sex or the microbiome of the genetics. For example, genetics, triglycerides plays a minor role. Glucose, it plays a higher role, a greater role. Microbiome is there playing a role no matter what. So, but we have learned that we cannot rely exclusively on genetics if we want to develop tools in order to predict the response and give recommendations. We have to move into this more holistic approach. Because we are in the middle of COVID, this is an hypothetical situation. If you have an individual that is high risk of diabetes or has diabetes, under the habitual diet, it may respond like that, the red line. That's bad news, obviously. And what is the outcome of this? Well, it's going to have a much worse outcome when it comes to the infection from COVID. But let's think about that time in which we'll be able to say, okay, this individual is going to respond poorly to food in terms of the glucose, but we know what approach to take in order to quench that increase in the glucose, and we are going to maintain this individual under glucose homeostasis. And then it will have normal glucose, and even if it's infected, it will have one of these mild cases of COVID, and it will not end up most probably in the ICU. So this is what we can achieve in the future if we solidify precision nutrition and we get the proper funding to do it. So what is the path? It has been mentioned in the panel discussion. We started with genetics, we introduced the microbiome, but now we cannot move forward without taking into consideration all these comprehensive personalization. And what is the future? The future is going to be more studies, like is the case of all of us, or PREDICT2 or PREDICT3, which are already embarked. It's similar to PREDICT1, but with many more people, 10,000 people. New technologies, and we are talking about non-invasive real-time biosensors, the lab on a chip, point of care, the artificial intelligence that has to come and be applied properly to this. But as in fact, as Ascension mentioned, that we need education. We have to educate the health professional. We have to educate the individual. We have to achieve precision public health, because we have to stop that fight between personalized nutrition and public health. No, it's something that it comes together. That doesn't have to be one thing or the other. And we have to make sure that it's available to everybody. And that implies insurance coverage in those cases in which there is no national health system, and in the case of the national health system, to incorporate these technologies into the health system. So what is the future for precision nutrition? Well, we have to have a clear destination. We have to have, we can call it GPS or whatever, and we have to be driving towards that goal that we all have. But what is important, and it has been mentioned already, everybody has to be brought to the table. As Jose was saying before, all these advances are the collaboration from so many people. And they don't have to be all molecular biologists or geneticists or biologists. Everybody has to come to the table in order to make out of these objectives a reality for the near future. And with this, I want to end my presentation and just finishing with the fact that yes, we have that kind of, in the short term, we have the darkness of the COVID, but we are very hopeful that in the near future, we'll be able to reach again the light and the colors that we used to have in the past, and that we really didn't appreciate at that time, as hopefully we'll appreciate in the future. Thank you so much.
Thank you very much for both of you for these very interesting talks. I think we've learned a lot today, and we could have a whole debate session right now, but I'm afraid we only have a few minutes left for some questions. So I don't know if any member of the audience want to raise their hands. We already show how it works. You have to go to the participants box and tick the raise your hand option so that you can ask your question directly to the speakers, or send a quick message so that we can, through the chat, so that we can address the question on your behalf. In any case, it has to be pretty quick because we're running a little bit out of time. So I'm inviting anyone who has a question to now raise their hands. Alternatively, if you come up with any questions later on, you can still send them to EIT Food, and we'll make sure we will redirect them to the experts. Okay, if it weren't for the amount of time, then I would be asking the questions, but I'm afraid we have to conclude this session. Thank you very much to both of you once more. And we will now reach to the end of the first day of the third Innovation Forum. We hope you have enjoyed all your sessions. I will pass you now to Begoña Perez, the EIT Food South Director, who will make a wrap-up of the day, share some conclusions, and we'll be seeing you all tomorrow at 9. Thank you very much.
Thank you very much, Afrodita. Yeah, it has been a long session. Thank you for being still with us. We have, with the help of the team, we have made some conclusions and some to-dos, both for the society, the consumers, the citizens, for food business, and for scientists to do. So if I might begin with the society, consumers, and citizens, I would like to say that, of course, all agree we are facing new societal challenges where the traditional health needs to become much more digital, but still being affordable. This is a good challenge as well to deal with. We know that nutrition is closer than ever to health. And for example, with the reinvention of the home cooking that can help us in theory in our personalized nutrition. But it was mentioned today that the chair, sofa, Netflix is the new smoking of our days with the lockdown time and the huge rise of digitalization. So we have to be very aware of that. So these kind of restrictions related with COVID are changing people's lifestyles, and the results are controversial, I would say, concerning the diet habits and the physical activity. So yeah, as the to-do thing for a society, consumers, citizens, we need to take care of ourselves from a nutritional point of view. We have learned that we need to be aware of avoid deficiencies. It was mentioned vitamin D, omega-3, and of course maintain a healthy lifestyles and do regular exercise. As scientists, we learned at the beginning of today that on the last months we have become more reliable people than before. But still there are not a popular information source. And about the to-do, one of the focus, especially in social media, should be done on making better links between the diet concept, because this is a very popular topic, and healthy food, that is not such a popular topic. So another message there. The combination of well-designed large dietary intervention studies and artificial intelligence with this multidisciplinary scientific expertise that we have seen today, for example, that will help us as well very much to make the progress and the practical implementation of the precision nutrition that we need to apply to prevent obesity and other non-communicable diseases. We have learned that there is not a perfect agreement or consensus about what constitutes a healthy or unhealthy diet, because we are complicated systems. We are complicated systems as human system and as a food systems as well, in their individual variability, in their dietary response, etc. And we have seen as well that the importance of immunonutrition can help us to prevent infections and inflammatory processes, and that will help us as well promote a good state of health and achieve healthy aging. And the third pillar, as business in the agro-food sector, there is some good news. So apparently, as citizens, we dedicate more time for healthcare. And at the same time, we are much more digitalized people. So that is something to do regarding innovation and business models, because they have to rapidly change and adapt. I remember that one of the speakers said that one of their clients mentioned that they were changing from a food service partner to a health partner. That is curious. So it's clear that we are in a great moment for innovation. There is no doubt about it. We cannot do anything other than go on offense mode. That is, understand what is the new economy, what is changing, where are the growth opportunities, where it brings us. And I remember one of our Portuguese food companies that when we had an interview with her, she says, this is the best moment for innovation because there is a sense of urgency and a lack of resources. And at the same time, we are out of our comfort zone. So for me, this is a great sentence to have on board. As well, we know that innovation is more relevant than ever for the food sector. because it's critical. We need to provide added value to consumers and not become irrelevant. And this we have seen as well in the projects presented by our colleagues. So we hope that all of you enjoyed our EIT Food Innovation Forum this year, and that we all have food for thought and inspiration to continue in the path to make our food sector more resilient, more strong, more relevant. And I would like to thank all the speakers, the participants, the moderator, and of course the team on the backstage, Lorena, Miriam, Irene, Chana, Lucia. We would like to invite you as well to our session tomorrow, where we will go deeper into the future challenges. And thank you very much.
Thank you, Begoña. And before you all get to leave, I would like to invite you to spend a few more seconds to answer a last survey on the session that you participated today. It is already on your screens. So just give your vote. Thank you once more very much for your presence today, and hopefully see you again tomorrow.
Okay, good morning, everybody. And thank you very much for inviting me to share this time within the Innovation Forum from IT Food. Okay, let me start with the principles for a healthy diet nowadays. A diet should be, of course, varied. It has to be balanced in terms of the different nutrients. It has to be moderate in terms of energy, satisfactory on the movement, social, sustainable, and to share. And all these principles should be focused to feel good, in positive for the people. I think more than focus only to prevent risk factors and associated diseases if we want to be successful. I don't know if you have think about how many meals we have across our lives. We have around 90,000 meals along our lives if we are women, a little bit less if we are men due to the differences in expecting life, about 82,000. And that means that we have to question if it is possible to follow a healthy diet during our whole life. Definitely no. Another introduction item that I think is important, nutrition is the only science for which, despite of the clear scientific advance, we are more and more surrounded by fakes, inputs, even disinformation. And this may be considered an additional difficulty to achieve really a healthy diet. What we strongly feel is that a diet is going to be healthier the further away you get from the myths, fakes, and mistakes surrounding food and nutrition. We were able to contribute with Spanish data to this very interesting study published in Lancet last year, in which one of the main conclusions were the main dietary related mortality risk factors. Those factors are as follows: high sodium intake, a low consumption of whole grains, a low fruit consumption, low intake of nuts and seeds, also a low vegetable consumption, and a low consumption of omega-3 fatty acids. I would like just to point out that most of the findings means to increase different components of the diet more than decrease. There has been already achieved in the way of thinking just from very recent years up to now. Okay, next, I would like to have a quick look into the current diet, and I will be using some critical nutrients according to WHO in Spain, like as added sugar, salt sodium, or saturated fat. First, I would like to show you our own data about contribution of macronutrients to total energy intake in the Spanish population, according to the ANAVIS study, which comprised a representative sample of the Spanish population from 9 to 75 years old. Well, as you may see, carbohydrates represent probably about 40% of total energy intake, really below of the lower reference range according to EFSA. And we were able also to have information not only about total carbohydrate, but also the distribution. So we have for total sugars, 70% of the total energy, for the starches 24. And within the total sugars contribution, we were able to evaluate added sugars for the whole population, 7.3, and for intrinsic sugars, the data that we obtained was 9.6. Our diet is also high in protein, almost 17% of total energy, and also high in lipids, 38.5%, especially when considered saturated fatty acid intake. Okay, I think we all know right now the recommendations that were launched by WHO in 2015 for added sugars, recommending to reduce the intake of free sugars through our whole life as a strong recommendation in both adults and children. WHO recommends reducing free sugar intake to less than 10% of total calorie intake as a strong recommendation, and fuel recommendation of 5% of total calorie intake as a conditional recommendation. Well, if we look into our Spanish population results, we may observe quite high differences between the older adults, 65 to 75, for instance, for added sugars, 5.1 of the total energy intake, and much higher from the youngest groups, like adolescents, 13 to 17 years old, or children, 9 to 12 years old. In fact, these younger population groups already reach the recommendation by WHO. This is important because we have to target the food policies according to group age, which is not very usual, I think. Okay, we were also able to have information about the main dietary sources for added sugars. The first contributor was sugar soft drinks, 25%, followed by sugar by itself, 17.8%, bakery and pastry or chocolate. In another study, we were able not only to evaluate added sugar, but also we look into the, let's say, the alternative that is being used very frequently to replace sugar. I mean, the low or no calorie sweeteners. Let me share with you some of the most important conclusions that we obtained. First, 42% of food and beverage consumed by the Spanish population had some form of added sugars in their composition. Secondly, 10% of foods and beverage contain some low calorie or non-calorie sweetener, LNCCs, and 5.1 of food and beverages simultaneously contain added sugars and low calorie or no calorie sweeteners. Okay, let's go next with salt. Also from our group, we have very recent information about salt, about sodium intake from the Spanish population. We exclude sodium from added salt on the table and during cooking. And considering these limitations, we may see that, for the whole population is already higher than 2 grams per day, which means that we are already exceeding the recommendation upper limit. And again, there are quite high differences if we consider the younger population, like children and adolescents, versus the older ones, much higher in the younger, much lower in the older. And we also obtained in this same published study some interesting conclusions. Well, as for the dietary sources of sodium, the main contributors were meat and derivative groups, followed by cereals and derivatives, milk and dairy products, pre-cooked foods, and finally fish and seafoods. These 5 food and beverage groups, in fact, account for more than 80% of total sodium intake in our diet. As for meal occasions, dinner accounts for 30 to 37% of the total sodium intake and may have a significantly higher sodium intake than women. And finally, and very interesting, overweight children show significantly higher sodium intake than those with low weight. However, no significant differences were observed in the other age groups. What happened with fat in our diet? First, I would like to show you the lipid profile by age group in the Spanish population. And clearly, there is a tendency to increase the saturated fat portion from the older people up to the youngest one. You may see 3 points of difference. The opposite way occurs for the monounsaturated fatty acids. Here you may see the main dietary fat sources in our Spanish diet. A very positive point is that olive oil represents 1 out of 4 grams of fat consumed by our population. But please take into consideration the second group contributing to dietary fat, which is meat and meat products. It represents more than 20% of the total fat. And if we compare this, for instance, with another usual component of a regular menu like fish and shellfish, you may see the difference, 22 versus just 4.2. This is really to have in consideration as a dietetic tool in order to modify, if it's necessary, our diet. And for saturated fatty acids, this is the picture. The main 3 groups contributing are meat and meat products, milk and dairy products, and oils and fat. These 3 groups summarizing around 70% of total saturated fat intake. Again, if we look, for instance, to fish and shellfish, the latter is also contributing around 3% of total saturated fat intake. Well, we are also working jointly with MAFRE Foundation in Spain, looking and evaluating the social aspect of foods. And I would like to show you a very interesting results obtained about the associations of different determinants with the body weight. What we found and published is that there is a higher percentage of people with normal weight among those who, this is in adult population, sorry, I didn't mention you, those that they make 5 meals a day, when breakfast is consumed regularly on a daily basis, if they have breakfast and eat at home, if they eat sitting around talking to someone, if they spend more time eating, if they are responsible for food with respect to the purchase and preparation of food, even if it's occasional, if they read nutritional labeling to select the products, as for the culinary techniques used, if they cook, grill, or bake, if they are influenced by concern for health and sustainability in purchasing behavior, if they have somewhat knowledge in food and nutrition, and finally, and not less important, if they sleep around 8 to 9 hours. So we are not talking about energy, calories, nutrients. These are really easy to get tools in order to modify sometimes our diet and dietary habits. and of course, nutritional status. Okay, let's go with the sustainability principle. We all recognize the evolution of the international Mediterranean diet pyramid from what it was just healthy to the healthy and sustainable picture right now. Why? Well, this is, I think, a very important statement. What weight influences decisively, we will say drastically, this principle of sustainability. Why? Food and drink accounts about 20 to 30% of the total environmental impact of human consumption. Let's say that everyone would like to live like an European. We will need the equivalent of 2.7 planets to meet the food resources that we are eating. And for the first time in the history of the world, the humanity's joint ecological footprints really surpasses the biocapacity of the planet. So what can we do? Maybe we have to take some personal decisions. Let me ask you these questions. What if we become strictly Mediterranean again, as it used to be our parents or our grandparents? Okay, there are good news. The greenhouse gas reductions will be about 70%, less agricultural land use, about 58%, much less energy consumption, over 50%, and much less also water consumption by 33%. In the opposite, what if we drift even more to the Western fast food model? Well, clearly, the previous indicators would worsen by 12 to 72%. And the question is, what do we think about or should we do in our environment in relation to food groups? The answer is clear. Take care of the local fish, legumes, for two goals. First, to better keep or even to recover our biodiversity, for instance, for legumes, but also to keep our legacy, for instance, in the Mediterranean. Well, as you well know, sustainability is also associated to food waste. We have been very recently able to publish the first data in Spain about disease leftover. And I would like to show you some of the results that we obtained. First, according to the menu components, bread was the one that generated the highest amount of food waste, followed by the unique disease, first and second course, and finally starters. In this same study, we were able to stratify the different food groups according to leftovers by age groups. And we found that vegetables account for the largest group of food waste among adolescents and adults. In the case of children, this was for legumes, and for older people, meat and meat products. Interestingly, older people were the age group that really generated the lowest amount of leftovers in all food categories. And in another study, we have been able to ask the adult Spanish population about the knowledge and perception on different sustainable items. For instance, do we attach importance to sustainable food? And three out of 4 respondents attach total or enough importance to the fact that the shopping basket should be made up of sustainable produced food. This answer was much higher, the green bars, for women than for men. Another interesting question, would we pay more for a diet more sustainable? The good news are that more than half of the population is willing to pay more for sustainable produced food. There has been really a big change in the way of thinking, at least in our Mediterranean countries, and compared, for instance, with the Nordic countries in this issue. And what foods do we think are most sustainable? Well, in here you may see that in positive, plant-based food, eggs, feed, but also dairy and meat are considered by the Spanish population as the most sustainable. Of course, there is somewhat disinformation about these answers. In contrast, respondents believe that processed food and soft drinks contributes less to the sustainability of the planet. Okay, let's go with satisfaction. One of the main principles to follow a healthy diet right now. And I really enjoy this statement by Professor Grande Cobian, a national and international renowned nutrition professor, who state people will eat what they should if they like it. This means that we should consider health as a priority, of course, but also pleasure of eating. And it brings to work together nutrition and gastronomy. And in fact, that's what we are trying to do. Let me just very quickly going into what we call new gastronomy in education, the Spanish model. What are our principles? First, enjoying experience is just as important as acquiring knowledge. Experience versus just knowledge. And the rationale for our programs is that learning should be, learning how to eat should be learned in the same way as we learn how to read, to write, maths, or even to listen music. The reason being that where in the past mealtime experience were at home and just within the family, now they should be also incorporated into the education system. And in consequence, we launched a new collaborative education program in our country from the Spanish Nutrition Foundation jointly with the Royal Academy of Gastronomy. And this program was also in collaboration with the Ministry of Education and the Ministry of Health. Just let you know that this is the front page of our education program, and I would like to highlight that the main message is el gusto es mío, it is my pleasure. Okay, it is not important only what you eat, but how you eat, the sociability principle for a healthy diet. And we're observing really quick changes in the way we eat, for instance, in our country. Before, I mean, one generation or even less ago, the usual was to have lunch or dinner on a table, sitting around, talking with parents, sisters, brothers, etc. Right now, there is a large heterogeneity in terms of the places that we have lunch, at the office, watching TV, watching the computer, etc. Moreover, I really would like to concern you about this concept of silent nutrition, what we call silent nutrition. Why? In fact, we are increasingly attending what we call a silent world. You don't have to shop at the supermarket. To eat, you may use barcodes or even shopping online. To eat in a self-service, like in a canteen for a company or for a university, the dishes are taken in silence. And when we arrive at home with the TV dinners or computer dinners, you eat self-absorbed without communicating. So would it be within the healthy diet and the lifestyle model, the Mediterranean way of life? We think that there is an urgent need of follow up this a new way of eating, at least in some countries, and evaluate, of course, the potential changes on the dietary habits. We're trying to do this evaluation. And finally, how are we behaving during the pandemic? What are the challenges and opportunities? Should we think and talk about a new nutrition transition? First, nutritional and gastronomic transition status, which is being carried out during the last few years, has been accentuated by the pandemic, and habits have somewhat changed just in few months. We have some information about adult population in Spain that showed us that the data during confinement in Spain show us more Mediterranean homes with more consumption of fresh products, fruits and vegetables, legumes and fish, also more local and sustainable, but at the same time, it is also higher in pre-cooked foods, usually high in fat, sugar and sodium, sugar in general, as well as higher in alcoholic beverage. The present and future moment must also serve to recover culinary skills, and in addition, if we are able to do within the family, I think it will be really a very nice point in order to get a healthier diet. And what will be the post-COVID consumer looks like nutritionally? More health concerns, of course, all related with the immune system or vitamin D, for instance, more Mediterranean, at least in the diet, but at the same time, less social, obligatory in most of the countries in terms of possibility of sharing food, for instance, therefore less Mediterranean lifestyle. The less purchasing power means the risk of going to foods that are higher in sugars, fats, and sodium. It seems that with more culinary skills, and of course, more technological, demanding food security, nutritional traceability, blockchain is a very emerging tool to cover this demand from the consumer, and transparency. Blockchain may be also a very useful tool that we are working about. And finally, I would like to conclude with some key points from my talk. First, the big challenge for the diet today, thinking in the health of the humans and the health of the planet. But is it possible, both approaches? What should be prioritized? Secondly, a healthy diet should be focused in positive to feel good and happy more than just to prevent risk factors and associated diseases. A must is to reinforce our personal autonomy for food decision, since the feeding process is strictly voluntary. And in fact, we are very heteronomous in food decision many times. A diet is going to be healthier the further away we get from myths, fakes that surrounds food and nutrition science. A recent shift, more things to increase in the diet than decrease. What would influence it, we would say drastically, the principle of sustainability. Nutrition and gastronomy must work together to achieve the healthy diet concept right now. It is important not only what you eat, but how you eat, for the principle of sociability. And to place a question, are we going to a new nutrition transition due to the COVID pandemic? Do we need to redefine the healthy diet principles in the very next future? Let me finish that with a sentence, a famous sentence from ex-President Obama. In order to achieve, to get these challenges, we should be really optimistic. Yes, we can, on an individual and collective level. And please, never forget that food is an absolutely voluntary process for over 98% of the population. Thank you very much for your attention. here are my emails. So if you have any questions, and we are running out of time, of course, I will be happy to answer you, or if you have some comment, it will be an honor for me. Thank you.
Thank you very much, Professor Varela, for this very interesting talk. I apologize for the technical issues that we had previously, and I take this opportunity to welcome you again to the third Innovation Forum. As Professor Varela mentioned, we are running a little bit out of time. So unless if there are any very quick questions that you want to share through the chat, we will continue with the next session of today's forum. So let's wait a few more seconds. And if not, Professor Varela was kind enough to share his email address. You can also share your questions directly to EIT Food, and we'll make sure we forward them to Professor Varela. I think there is already there's some comments thanking Professor Varela for a very interesting and informative session. So if you don't mind, for time restrictions, we will proceed to the next session. The next session is entitled Looking Towards Agri-Food Futures. And for this, we have the pleasure to introduce you to Ryan Edwards, co-CEO of Naked Innovations, together with Samantha Pena, co-creator of Naked Innovations. Thank you very much, and we hope you enjoy this session.
Thank you. Thank you for the opportunity. Good to see everybody here. I'm just quickly sharing my screen before we have a nice video. So yeah, today is really the launch, if you like, of Agri-Food Futures. So we're excited to see a number of you here who are part of the community. And those of you who don't know about the community, you're going to learn all about it now and get involved. And we're going to start actually talking, collaborating, and learning about some of our experts. So we're going to have some highlights now, which on a video, which I'll share with you. Then we're going to hear from Jürgen and Didem at high level. What is the community? What are their expertise? See some of the expertise that's in the community. Then we're going to have a panel discussion from Tristano, Sarah, and Francis about what it means to be an expert and collaborate in this way. Then you're going to have a chance to actually go into Zoom breakout rooms, connect with some new people, get to know each other, understand each other's backgrounds, and actually we're going to ask you to help us design this expert community called Agri-Food Futures in the way that you want it. What's the best value for all of you? Where can we bring you together to solve some of the big challenges in agri-food today? And then we'll have a close from Begonia Perez. Okay, so with that, we're going to see our communications manager, Miriam Stevens, introduce us to the agri-food community.
Hi all, I'm Miriam. I'm the Agri-Food Futures Community Coordinator. According to our surveys, 8 out of 10 experts want to keep up with the latest trends and news in the agri-food sector, and 7 out of 10 want to connect with like-minded individuals. Are you as well in the same situation? It is true that COVID has somehow taken us apart. We feel more disconnected, but if we think about it like a few seconds. We have never been as connected before. Like just right now, we are conveying a message and you're listening, but in a few minutes you will be in breakup rooms, meeting each other, interacting, exchanging ideas. And that is what we want to build. We want to build a community of collaborative experts working together on innovative solutions to make the food system more sustainable, healthier, and more trusted. And in the end, what we want is you to connect. It's easy, right? At least it sounds easy. In the last year, we have been assessing the engagement levels, the objectives of the member, what you really want to get from the community, the quality of the members, and above all, we have worked on a strategy to keep growing the community. And that has been thanks to you. Because obviously we cannot build a community on our own. Like a community is made of people. We need you, and we're working on this with you and for you. So thank you in advance. In the last year, we have double-sized the community. The quality of the engagement levels has increased, and we have already discovered which are the topics that you are most interested in, which are sustainable agriculture, targeted nutrition, alternative proteins, and circular food systems. What else can the community offer you? obviously we're trying to offer many things, but mostly we want to expand the industry knowledge. We want you to exchange opinions and ideas, and feel free to say what you think. We want you to strengthen your personal brand. We want you to be informed of all the relevant activities in the sector, not only from EIT Food, but also from other stakeholders. And we are working really hard to do that, and we will keep improving next year. So that's why we need you here working and telling us what you want to get from us, because we will do our best to get it. So thank you. If you are not already in the community, please join the community. Right now we are on LinkedIn, even if we may move a platform soon, but you will be communicated of any change. So please join, and if you have any doubts, you just have to write to me, and I'm at your disposal for anything. So thanks.
Thank you, Miriam. Wonderful. Yeah, exactly that. I echo that. Please get involved, connect. I believe for some issues related to how the world is, and I don't think Jürgen's been able to join us just yet. Let me just check though. Is Jürgen on the line? Okay, I don't think Jürgen's able to join us, which is unfortunate, but he is part of the community, so I'm sure you'll get to connect with him at some point if he's not able to join us. But we will move on with Didem, who's going to share some insights with us. Didem is an R&D leader, a lot of history in the agri-food industry. She'll tell you more about that. So Didem, with that, I hand over to you.
Hi, good morning, good afternoon, everyone. It's an honor to sit here and listen to most of you in the last few days. I learned a lot, and I really hope to keep in touch with a few others. Suppose you can see my screen. So I operate out of Turkey, and the way I came across with the community has been very, very recently more active, but I have been following EIT Food for a long time now, just because it's an awesome go-to place for me to both feed myself and also my customers and people around me with the type of content that we have with different partners across Europe. So just a little bit on how I think I do contribute to the future of food. I'm a food engineer by background, as I said, located in Istanbul, but I had quite a good reach of different food countries, food and beverage businesses across different places. So I operated in Turkey, the UK, Middle East, Africa, covered the East Europe market sitting in Turkey, or operated in France, living in France and the UK. So had the chance of seeing, eating and doing R&D in various different countries in my past life. I had about 6 years of research center experience, but most of my experience sits in the FMCG in R&D. Very recently, the last 2 years, I am freelance consulting out of Turkey. So my customers are various sized. Also, there are SMEs, there are small startups or scale-ups that I mentor. So just to pick up from where I left, my specialties are on product design, category and portfolio management. So in the new world that I operate, and I'm very much motivated in working in ecosystems, in diverse environments where we can be creative and collaborative at the same time. I serve multiple customers, and I offer results-oriented environments where we can either deliver research results to market or solve some market problems using research, if you like. So just a little bit of how I try to operate. I mean, obviously, there's quite a lot of shadows we cast, and I always take this as a team effort, which working for a corporate for 20 years has been actually relatively easy. So even if I was located in Turkey, which is a developing country, it doesn't have a lot of resources, we were part of a very big corporation, and there's always an expert who knows how to move on. If you don't know how to move on, there's always someone as the go-to person within the organization. So that was quite a good background for me. So it grew me, but also it left me a bit weak, if you like, in the last 2 years. So being able to only operate on as a freelance basis, I looked for, okay, which other people are asking the same questions. I'm trying to answer the same question. So the bottom of the pyramid always is the what. The knowledge, evidence, and the facts are very relevant and important for the consultancy questions to be answered. So I also collaborate with some universities and research centers, but EIT really comes in here. So there's quite a lot of information that I use and I seek from the experts, from the system myself as well, because this is not where I am very strong. This is where I really need the rest of the network to help and also reciprocate in that. So this is where I actually need more support. The places that I actually feel the jigsaw pieces are the how and the why of the things. So again, there's quite a lot of collaboration with the producers and suppliers, etc., helping the producers of the question about how we build sustainable food systems. And there's also the advocacy and the purpose side of the things. So without these, we can't make a real change happen, if you like. And also keeping the user and the insight side of the things always in mind is also important. So any research question, any deck that we present, any contract that we sign, I think has all of those pieces. So the communities that I belong in and the associations in Turkey as well gives me the strength to be a full person, if you like, a full body to be able to help the same question. We are all in this together to help build the sustainable food systems. So I quite like to use the circular economy diagram from Ellen MacArthur nowadays, because back to Professor's presentation, the nutrition challenges that we have in Turkey and most of my my customers are very similar to what I heard from the Spanish insights. So the obesity is high, rising high. There's on top of this, there's quite a lot of cost challenges on the consumers' hands in Turkey and the producers in customers that I work with. So really the principles of designing and marketing healthier food products, like in any other place, is very, very critical. Together with the making the most of food, the waste and the byproducts and the strengthening of the bioeconomy is even more important than anywhere else, I think, in the geography that I operate. Because our systems are relatively fresh and young and very much export-oriented, agri-business in Turkey is here. So there's a lot of investments happening on everything. And if you design the systems to be circular, this is a chance. So we don't have to fix it later. We can fix it from the design. So this is more of the areas that we operate in, to help companies with the byproducts, help them with waste reduction, ways and technology maps, and actually projects as well to put the circular economy into action. Plus the food into cities is a very important part, which I didn't necessarily think about in my 20 years of food business, working for a corporation. We serve quite a lot of cities and the city managements on how we can actually design better and make the most of the food, thinking about the system boundaries as the city itself or the region itself, or across borders even. So I've been involved in some water scarcity challenges very recently, and you got to have to think about the cross-border trade vulnerabilities to make it work. So just a few final words. What I can give to the community is definitely whatever I have from a contacts perspective, a very fresh ecosystem of startups in Turkey and also research organizations who are very happy to collaborate. The area that I'm learning recently is the environmental side of the things and also the city side of the things. So there's quite a lot of pilots that we have started and I am involved in. So that point of view is also very much in offer with the way that we think about the resources and the symbiosis from an idea perspective. And finally, obviously, I would love to learn a lot. So with any initiative, there's quite a lot of things that I take as notes to myself and I keep on learning. So that in a nutshell is what I have to offer. You got my contact details over here, so feel free to just reach out anytime if we can help you at all from quite a rainy Istanbul day today, but anytime it's easier to contact. Thank you.
Idem, thank you for sharing. It's great to see the kind of expertise that we have in the community. We have over 450 experts now in the community. So just a few questions really. And if anybody in the audience has a question, do put it in the Zoom chat. So I'm just thinking, Idem, what is it that sort of attracts you to being in a community such as Agri-Food Futures?
As an individual, I am very much intellectually curious and I can't know enough, you know. So the community really makes me feel stronger. And if I want to know something, I have a go-to place. So I think it really improves the way I have my links across different type of subjects. There's also quite a lot of, this also was something I can see some of my previous colleagues from the corporate in the Zoom area. The relationship, I think, is what makes research really very special and also sustainable. So every contract, every project that we run is not a one-off. It's part of a big question. So the sustainable system is a big question. So I really would love to build the relationship to be able to move to a next question that we might have as a group. So that's more about the network, I guess.
Yeah, for sure. And that makes a lot of sense. So what is it that you feel that is like the biggest benefit? What can you get out of a community like this?
The specific go-to work subjects did work a lot for me in the past. So for instance, the water scarcity challenge was quite a good one for me to actually focus on a particular challenge. But I was also working on a similar challenge at the time. So I guess the focus areas and the research strategies do align at the end of the day. So that really helps you focus the subjects of focus from a strategy perspective.
Yeah, and cool. So we all, I think, agree that there's huge potential in bringing the expertise together. So what do you think is maybe missing, or what are the challenges that we face so that we can really fulfill the potential that's there?
Mm-hmm. I think I'm not sure if I have everything it takes to answer this because it's been quite a short period of time, but from the first 6 months, if you like, that I've been more actively involved, the communication routes could be a bit clearer. So I actually need to kind of have a go-to place to really follow what's happening and not necessarily kind of prompts of what's coming up. The community is very, very diverse. So there's a lot of areas of focus and most probably a lot of areas of preparation for the coming days as well. So I have the needs of almost like a go-to place about an event calendar or something that prompts me what's coming. It's been quite short notice, if you like, on some of the events that I've been pulled into. But in general, so far so good. I really benefited big time, and I'm hoping to give back more to the community than I've been taking in the next few months.
I love that spirit, exactly. I mean, together we can all create and share and give, but also, yeah, benefit. And I think this is exactly the kind of conversations, just for everybody, that we want to have with members of the community. This is for all of us. That's how EIT Food want to design this. It's not about ownership. It's not about us extracting value. It's about how do we all help one another to solve some of the big agri-food challenges we're facing. And so this kind of feedback that Didem's sharing is exactly what we take note of. And shortly, in about 20-25 minutes, when we put you into the breakout rooms, we're going to be asking you to have this similar conversation and filling in a form because we really want and value this feedback. This is what we've been doing for the last, well, forever really in the community, is understanding what drives you. And Didem, as you say, it's about, yes, we're from farm to fork. We're looking at the whole agri-food system because it's very connected. But we also recognize there's a need to have subgroups of expertise where you can come together around specific challenges. Just to wrap up, and I say, if there's any questions from the audience, please do share them. But throughout your career, what you've worked in so many diverse areas, what's kind of been, do you feel the benefit of having that diverse experience? What does that bring to when we try to solve challenges and create innovative solutions?
Mm-hmm. It might be a bliss and also a challenge at the same time. that I don't back up from a challenge. I mean, it is a big question that we're trying to solve. The system is broken, and really we would like to do quite a lot of positives, bring quite a lot of positives into everyday life in our careers. And that's not necessarily very easy to keep motivated all the time. So I think seeing very diverse areas and diverse consumer needs, I have the confidence in me to say, if you know the answer, somebody does know the answer, or if it hasn't been done before, most probably that's going to be the first time, and it's going to be okay, you know? So I think it gave me a chance of having a technical confidence, if you like, in asking the question, challenging some of the status quo, both in the market conditions and the consumer's preferences, and also the technical side of the things. And that's the strength of being a community. I can't do it on my own, but we actually can move some stones. Definitely, that is a confidence point.
I love it. I love that. That's a great summary. For me, that's exactly what the message we really want to share. So thanks, Didem, for kind of being an ambassador here. As you say, you've only been there a short time, 6 months, seen benefit from it. But we take really seriously your expertise and your feedback, as we do everyone who wants to be part of this community. So thank you, Didem, for your insights, your time, and we're going to continue to collaborate.
Wonderful.
Cheers. And if you want to connect with Didem, please do in the community. You can get in there and stay connected and explore opportunities together. Thank you. Okay, so with that, I'll just moving us on to the next section of today. So we're moving to the experts corner. This is where we want to gather, what's the kind of looking a bit more, what's the expertise that exists today in the agri-food futures community. And one of the things that we just heard from Sarah there was we have over 450 validated experts, which is fantastic, across the whole agri-food supply chain, which is a huge one. So what we're also doing is saying, well, we know that people want to be in smaller groups so they can get to know each other on a more personal level and really have common expertise around common challenges. So one of the things we've done this year is create subgroups of expertise, one around alternative proteins, and another around what we call smart agriculture, sustainable agriculture. And here we have 3 people who are in those expert subgroups. So we're going to go in the order on the screen. Each of them are going to introduce themselves for a few minutes to tell their story. And then with the 3 of Tristano, Sara, and Francis, we will then have a Q&A. So as you're listening to them, please do write any questions you have for them, whether it's a technical question, lots of technical experts here today, or a broader community question, write it in the Zoom chat, and we'll get to that afterwards. So we'll start with Tristano, who is the founder and head of research and development at Cora AgriLab.
Well, nice to meet you all. Thank you for inviting me. Yeah, brief introduction about myself. I graduated in agricultural sciences, and then I got my PhD in microbial ecology. Few years I've been working with postdoctoral experiences, always in the area of understanding microbial interactions, but really throughout my almost 15 years of experience in the academics, I have touched various kind of sectors or areas, from microalgal production to show my video. Hey, hi, I'm also on a video.
Ah, there's the good-looking guy. Good to see you.
So yeah, microalgal production, biodiscovery, mainly antibiotics. I work on bioremediation, wastewater treatment, microbiome. I really was interested into gut microbiomes. So yeah, a lot of, in a way, biotechnological areas, but all of them looking at understanding how microbes interacts with each other and with higher organisms to perform functions that we may in a way exploit to solve our pressing needs. So this was the academic trajectory. About maybe 6-7 years ago, I decided to move into the more like entrepreneurial sector. So I did a master in agri-foods businesses. And from then on, I worked in the agricultural sector mainly. First with a food company, actually doing developing foods supplements and selling them. And then I founded my own startup, which is really a research and innovation focused business. We look at again, that bringing my expertise from the academic my academic history. We look at plant microbes interactions, and we are particularly interested in a way influence the processes that are beneficial to crops, and particularly how roots recruit microbes that are beneficial to them, and at the same time how microbes influence plant physiology. So, and understanding that, developing actual products and based on natural compounds that can influence this process towards making more sustainable production systems. So this is pretty much my history and my interests.
That's awesome. Thank you. Thanks for sharing. And yeah, we've had a really interesting story as well, haven't we, Tristano, over the last sort of 6 months, how startups pivot and how things change and the opportunities that come and go. I'm sure we can share that story behind the scenes or here or something later. But it's amazing how in this time where we've never physically met, you can develop relationships and support each other on all sorts of different projects and finding different ways to collaborate. So thank you for sharing that, Tristano. We'll now hear from Sarah Oliveira, who will share her little story too, please.
Hi, hello. It's an honor to be here today. I want to first thank the organization for inviting me. So I will share with you some of our expertise and interests in alternative proteins made with cells and other 3D food printing applications. I'm a research engineer at INL, which is an intergovernmental institute organized in 6 clusters that work in an integrative manner to provide the best solutions. And in the food processing and nutrition group, we have 3 main research lines: functional foods, food personalization, and food packaging. One of our tasks is to find the best solution to reverse engineer the bovine or other meats at the proteomic, nutritional, appearance, and organoleptic level. We research 3D food bioprinting, which is printing food ingredients blended with living cells and sees that the best candidate to reproduce the complexity of meat. And there are many process questions yet to answer for each specific application, such as which edible inks are needed to achieve the best outcomes in a scalable manner. We want to structure the cells, feed them, and allow them to grow and mature like in the animal body, but on a large scale. And with the MEATED project that was granted by GFI, we work on the root of some of those challenges. We developed inks for high-speed printing and create models to understand how to control the texture. Besides technical needs, future consumer acceptance is also an essential point to look at. We, our researchers, can provide information, show what meat is, how it is made, and that printed products are safe and can be even more nutritious. Actually, a recent study showed that people working in the meat industry are more willing to consume cultivated meats, and also that people who have eaten a printed cookie are more willing to accept printed meat. Could, for instance, the acceptance increase a little bit if we show that shaping the dough with a specific design improves the cookie's antioxidant activity because we can bake, dry, and brown them faster, preserving even more bioactivity of the included polyphenols? I close by showing a part of my expertise. I'm a biomedical engineer, worked for 7 years in tissue engineering, and biomaterials. And after my first postdoc, decided to do a kind of radical change and moved to 3D food printing at INL 4 years ago. My knowledge ranges from cell isolation, coatings, growth factors, cell instructive surface and 3D structures, additive manufacturing, cell behavior, cookies, cultivated meat, and several types of food inks, among others. And I've also closed by thanking INL, GFI, my mentors, Lawrence Pashan and Pavel Fusins, and my colleagues, and everyone that contributed to my expertise, and by inviting you to checking on this special issue invitation. And thank you all for your attention.
Sarah, thank you for sharing. It's great to see all the cool things that are happening inside the community. And I love that you recognize that together, you know, the expertise that you've built is on the shoulders of others who have taught you and collaborated with you and shared with you. And that's exactly what this whole Agri-Food Futures community is about. So awesome to have you here. We're just going to move on with Francis, and then we'll have the three of us have a little conversation. So Francis, welcome.
Thank you, thank you. So my name is Francis Wanjohi. I'm a student at St. Stephen University doing my PhD, the second year, researching at the National Research Institute of Hungary, Agricultural Research Institute, and carrying out my research on sweet potato. Specifically, I'm interested in mechanisms of virus disease resistance in sweet potatoes. A brief background about me. I worked in Kenya doing business technology transfer promotions between Hungary and Kenya. I've also done some bit of advocacy for biotechnologies just to help change or improve the policies of agricultural biotechnologies in Kenya. My current interest is a promotion of smallholder food production and generally to increase food security and nutrition among smallholders, not just in Africa, but across the globe. Right now, I've been producing sweet potatoes here in Hungary, and I'm looking forward to getting some improved varieties, which we can give to producers to multiply and give to the farmers. So bottom line is I'm passionate for food security and just to empower the farmers and feed the people through biotechnology, of course. Thank you.
Awesome. Thanks for sharing, Francis. No, it's an awesome story. And I love the idea as well that we saw from DDEM, a very broad view of all the things, all the different projects she's been involved in across the continent. But also there's such a deep knowledge here as well, I think, as Francis is sharing, right down into focusing on smallholder farmers around sweet potato varieties. It sounds quite niche, but it's such an important part of what we're doing to have that deep expertise on something that's quite specific. Awesome. Thanks, Francis, for sharing. So bringing the three of you together, Tristano, Sarah, and Francis, sort of a few questions I say to the audience. Please, if you have any, do put them into the Zoom chat. Don't be shy. So I guess my question to the three of you to begin with is, what is the biggest, for each one of you, what's the biggest challenge you face right now regarding your projects? Maybe we can start with Tristano. Oh, you're on mute. Yeah. Well, we can start with Francis. You're not on mute. So what's your biggest challenge right now?
Okay, currently, actually, the biggest challenge I'm facing, I would say, is this COVID situation. I didn't expect it, and I didn't know that it would really affect me so much, because starting from March, when the lockdown started across the globe, I've been trying to get some varieties of sweet potatoes and some samples from different several parts in Kenya, in Ghana, and a few other places. But up to now, where the year is ending, I haven't been able to get them for various reasons. One, the people who need to give me these varieties or samples cannot work every day in a week. So they work maybe 2 days, and that is a big challenge. Secondly, there is the problem with certifications. I cannot get the relevant papers because, you know, it involves international movement of plant materials. And thirdly, sometimes I lost time of collecting crucial data just because I had a small chest problem and therefore I had to be quarantined and I could not collect my data, and it's lost for the whole year until next summer. So seriously affecting my research and work.
Wow, that's heavy. But what I really appreciate, what's so important in these kind of conversations is sharing our challenges. You know, feeling, and it's great that you share that openly here. Feeling as we build this community, trust to be able to open and transparent of, hey, these are the challenges I faced. Does anybody else face similar challenges, or someone else got a solution to this? So thanks, Francis, for sharing. We'll go reverse order. Sarah, would you like to share what's your current biggest challenge?
Yes, so my main challenges are, yes, COVID has been delayed the project, and probably it might get worse in the next weeks. But also there is a lack of funding. It would be good to have some more funding and to have more people to get involved in the field of cultivated meat, because it takes a different kind of know-how. It's like a merge between tissue engineering and food engineering and many other fields. But for the case of 3D food bioprinting, that have to be dedicated to that, because we are not making a regular food product nor a tissue engineer product, and it's challenging. I think it's basically that.
It sounds super challenging. So just following up on that then, how would you normally go about solving that? Would you, do you tap into other experts, for example, in the community, or is it something that you try to fix in-house?
For now, I'm more focused on doing the project, but the best would be to get a grant, and then people will learn, because the people with more expertise are in the startups, and even those are learning and understanding what they have to pick from each field, because not everything will work, and the information is closed in the companies, so there is not much actually technical data around that can help.
Makes a lot of sense. It's a big challenge.
Yes.
I'm confident you'll find the solution. Okay, thank you, Sarah. And Tristano, what's going on your side? What's your challenges?
Yeah, I share some of their challenges, particularly related with doing research. Obviously, we build our value proposition as a company on innovation, and to do innovation, you need to access funding. So that part is obviously tricky in a way. There are ways, but it's fundamental to build a good network, and as a new player, that's at the beginning of it. It's obviously complicated. There are opportunities to build network, and this is this same group here. It's a fantastic opportunity for us to engage. Obviously, there are European calls that we could apply to, but all of them, need to build this large consortium. So it's, that's that part. We dedicate a lot of effort into that part, building the network. And also because we do have a couple of solutions that we have tested and feel confident that could be taken up by the market. Now it's all about performing field trials, so building confidence with other stakeholders. So that part is also challenging and take a lot of our times. But yeah, it's very good to see things moving. So yeah.
That's awesome. Thank you for sharing. So I'm going to ask one more question, and this question for the three of you, but it's going to be a similar question that we're going to ask all of the audience when we put you into breakout rooms in a few minutes. So what do you feel is the your sort of impressions of the community so far? Any benefits that you've got from it? And related to that, what value do you think you can get from it? So either the value you've already got, if you have, or what value you would like to get from the community? What do you see as the potential here? What is the benefit that you see in a community like Agri-Food Futures? And Justano, as you're here with me right now, what do you think on that?
I have been involved with the group maybe it was 3 or 4 months. The most benefits, I guess, at the end of the day, we are human beings and we interact with other human beings. So when you find that person that has knowledge on something that you need to answer and is available, you create that connection, and that brings value to you. So in my case, was really connecting with a couple of experts that helped me better understanding how I could present my value proposition and develop it in a market context. So to build up on that, I think it would be very useful to have a simplified access of the information. We are now here, how many, 60 people. Obviously, I see the names. I'm not sure what they are doing exactly, but having that information structured where I could, reach somebody, because I would expect that person to be able to solve a question that I have, that would be, I think, very good for the development of the community.
Brilliant feedback. Appreciate it. Francis?
Thank you, Ryan. As Trisana has said, I think the biggest benefit so far is the network. I'm just glad to be part of this real community, people you can have real conversations with, people who share some similar goals. So as I said once in the group, is that my interest is to work on real projects, So this is what I'm looking forward to in this community. I wanna help solve real life problems, which could be challenging, but would utilize my expertise. So that's my view on the future of this community.
I love it. I love it. Yeah, real impact, and makes a lot of sense. And as Tristan was saying before, the human connection, which we all long for. And just to finish us out, Sarah, same question. Any value you've seen or that you expect going forward?
Yeah, I see the community like a new way, or it could be a new way to create teams. A little where we could use the know-how for consortiums, or it could be a platform where the IT food partners would provide challenges where we could help on that. And the difference here is that the platform could be also a way to find new talents, or to fill the gaps of the multidisciplinarity that new things, new products are requiring, like cultivated meat. And the advantage that I see here is that we have platforms where institutions or companies can challenge the users, and they can submit proposals with preliminary results or not. But the difference is that in those cases, the person is limited to his knowledge or his own network. And this could be different because the team is built, is tailor-made to the idea or challenge. And there could be kind of selection work made that the person that has the know-how, that the expert is not prepared to do that. Is not like he has the expertise, but maybe lacks the ability to select the best people to work on the thing. Maybe.
Yeah, no, that's fantastic, and I love your belief in this, and as you kind of cohorts, collaborations, commons, these ways of working, new ways of working, open innovation. There's huge potential there, and I think a lot of that's based on trust in each other and the real expertise in the room and bringing together that fresh perspective, the diversity. So thank you for sharing that, Sarah. Thank you, Tristano, and thank you, Francis. All three of these great people, experts, are in the community. So if you want to stay connected to them, join the community, reach out to them, and learn more. Thank you to our fantastic expert speakers so far. They're in the Agri-Food Futures community. We really hope that you, if you're not already there, join us, connect with each other. And with that, I'm going to pass over to Begonia Perez, who is the EIT Food South Director.
Thank you very much, all of you, for participating in this quick session this morning. So we only have a few minutes for closing up, but I would like to, so I have picked up some of the things that you guys have said, beginning with our first speaker this morning. I have picked up one sentence that I found quite important, as I have shared with my small group. The sentence that he said is what Gabriel said. It was: a healthy diet should be focusing positive to feel good and happy. That means enhancing the nutrition and gastronomy links, more than just to prevent risk factor and associated diseases, if we want it to be effective. So for me, this is an important issue that we have to remind. Regarding the network community that we have been working this morning, I like very much what Didem mentioned at the beginning, when Rian asked her what cultivate relationship and network community make us to feel. And she said that, of course, it makes us feel much more connected to, but stronger, sustainable even. Another participant say allowed to discover and find new talents. And more or less what the conclusion of that was, that co-creation is essential to evolve as a society. So we are picking up the mission that we want to pursue with this network. We will improve it. We will improve the community with the creation of new subgroups. That was something that you mentioned, based on sector, on interest, on demographics as well, aligned with strategic focus area that we will do. We are moving to a new platform with better functionalities that will allow us to have tools to grow and engage. And we will continue to engage members to discuss the hot topics and trends by bringing the real projects and challenges from EIT Food Partners and other stakeholders to collaborate on. So we count on you for continuing doing that, and we will hear from us and the improvements that we have mentioned. Thank you very much for your participation.